Good morning, everyone. I would first like to extend a warm welcome to our esteemed panel members who have worked tirelessly day and night to make this seminar a success. It is truly an honor to see all of you gathered here today for this presentation aimed at fostering the growth and advancement of Ayurvedic science. Without further delay, let us begin by paying our respects to our teachers and mentors as we proceed into today's session. We have a series of highly interesting topics lined up for discussion and exploration. With that, let's move forward to our first presentation of the day. First, I would like to invite Dr. Rohit Anil Kajale for the paper presentation on the topic the effect of Jalaukavacharana in the pain management in case of thrombosed pile mass.
Now, next is my paper presentation. The title is The Effect of Jalaukavacharana in Pain Management in Case of Thrombosed Pile Mass. The abstract is the author name is Dr. Rohit Anil Kajale, and my guide name is Dr. Jagruti Rode from Gramin Ayurved Mahavidyalaya, Patur, Akola. The abstract is Arsha is an alignment that affects all economical groups of population. These are vascular tissues within the submucosa of anal canal, comprising of loose connective tissue, smooth muscles and blood vessels with arteriovenous connections. Through the disease is within the limits of management, it has its own complications and severe hemorrhage. Thrombosed hemorrhoid is an emergency condition and occurs due to high venous pressure associated with several anal pain which occurs due to back pressure on the anal venules, consequent upon straining at stools. Each application had shown thrombolytic action which contributes in re-establishment of circulation and it relieves venous pooling of blood in that area by dissolving clotted. It is observed in the study that this method of treatment is found to be effective and increases the quality of life in patients suffering with thrombosed hemorrhoid. Introduction. Hemorrhoids are one of the common anorectal conditions encountered in daily practice Acharya. The incidence of hemorrhoid is common among all economical classes of population. Now, regarding the case history, a 40-year-old female has thromboid pile mass visited OPD of Charlatan department. There was no history of any disease and all. On the basis of clinical examination, the patient was diagnosed as a case thrombosed hemorrhoid. The patient was not willing for any surgical intervention, therefore decided to do Jalaukavacharana after routine examinations. Aims and objectives to evaluate efficacy of Jalaukavacharana, to give painless management. Materials and methods: Jaloka, water, gloves, gauze paste, cotton pads, haridra, churna, bandage, threads. Subjective criteria: shul, tenderness, discoloration. Objective criteria: size. Intervention: Jalaukavacharana procedure. Purvakarma: leech should be transferred from pot to vessel containing fresh water. Leech should be cleaned well. Pradhan karma: the position is lithotomy. Site: around the pile mass. Site should be cleaned with warm water. Leech is taken out of the water and is being kept over the site. Leech will attach with a few minutes. If the leech don't get attached, then small prick over the site can be done. Thin cotton piece is dipped in water, made to spread all over the body of leaf. The leaf should not be disturbed till it detaches from itself. Leaf should be allowed to stay over the site for 45 minutes. If didn't detach then it should be detached by putting small amount of turmeric powder over the mouth of leaf. Karma. After detachment site, the bite is clean. Leaf should be transferred to vessel as soon as possible. A mild massage with index finger is given. As soon as vomiting procedure is completed, leaf can be transferred to vessel. Later, the leaf can be transferred back into the pot. Same leaf should be kept separated from other leeches. Subjective symptom: pain scale 0 before treatment. After third sitting, 0, minus, plus. Result: decrease in the pain and tenderness of thrombosed bile mass along with its color varies from bluish purple to normal color. Size of thrombosed bile mass decreases from 6 mm to 3 mm. After third sitting of Jalaukavacharana discussion, hemorrhoids are dilated vessels in the anal canal, subicular regions found by radicals. Conclusion: significant relief of symptoms of thrombosed bile mass, including pain, tenderness, discoloration, was being observed in the course of treatment. Because of constituents in the saliva of leeches, immense pain and tenderness at the site of thrombosed bile mass get diminished, and gradually color and size of thrombosed bile mass become normal. References: Agarwal and Singh K. P. Mittal K. Das. Ibidem, Bhat SM, Richard Bharadwaj. So now talking about the subjective symptoms assessed before and after Jalaukavacharana was mentioned in the table. Before treatment and after treatment, there was a significant reduction in the bile mass. Discoloration was bluish purple and tenderness was also reduced. So overall, talking about this case, it can be said that Jalaukavacharana is really helpful in case of thrombosed bile mass, as thrombosed bile mass are extremely painful to patients. If the patients are not ready for the surgical intervention, then this procedure is extremely useful as it is cost effective, almost painless as compared to that of an operative procedure. And also according to the patient's will. So one and all, it can be said that this is an extremely useful procedure. That is the effect of Jalaukavacharana in pain management in case of thrombosed bile mass. Thank you.
Thank you, Dr. Rohit, for the paper presentation. Next is a poster presentation of Dr. Rohit. The topic of poster presentation is Chakra and Marma of body and Mudras with its benefits.
Good evening, everyone. My poster presentation topic is Marma, Chakra, and regarding yoga. So I'll explain in short. There are 6 chakras in our body. That is Sahasra, Vishuddha, Anahat, Manipur, Swadhisthana, and Muladhara. Sahasra is located right near the forehead or between the eyebrows, we can say. Vishuddha is located near the thyroid gland. Anahat is located at the heart region. Manipur is located at the umbilicus region. Swadhisthana is located at the urethral region. And Muladhara is located at the anal region. So accordingly, there are the functions of these all. And marmas, regarding marmas, these are Adipati, Stapani, Matruka, Rudya Marma, Nadi Marma, Basti Marma, and Gud Marma. These are correlated with the chakras accordingly. Now, about the mudras, different yoga mudras for different chakras. The first is Prithvi Mudra, second is Varun Mudra, third is Agni Mudra, fourth is Shayan Mudra, next is Vayu Mudra, next Akash Mudra, and last is Hakini Mudra. These have roles and functions according to the chakras and marmas mentioned above.
Thank you, Dr. Rohit Anil Kajale. Thank you for the presentation. Next, we go to the paper and poster presentation. Next, I would like to invite Dr. Pranita Pradeep for the paper presentation. The paper presentation topic is Agnikarma treatment in the management of corn, the kadar.
Good morning, everyone. Myself, Dr. Pranita Pradeep Chandgude, third year resident from Dr. Vandanathai Gramin Ayurved Mahavidyalaya. So, today's topic for my paper presentation is Agnikarma treatment and in the management of corn or kadar. So, basically, Agnikarma is regarded as the best of the because of its quick result and long-lasting effect. It is said to not recurrence of any disease when treated with Agnikarma and also disease which are not treated with medicine. Shastra and Shar are the best treated with Agnikarma. Ayurvedic classics state the use of Agnikarma in the management of various kadar is one of them. The pathological of kadar is caused by vitiated meda and rakta by injury to foot, which in turn lead to the glands like hard skin texture at foot known as kadar. In the present case study, the efficacy of Agnikarma in management of kadar are stated in the Ayurvedic text evaluation. Methodology. Agnikarma was done with shalaka with extraction of kadar followed by application of oil with 3 settings in which each setting is for 3 days. Proper follow-up was taken for about 6 months in order to observe for any recurrency. Observation. It was observed that within a month, the complete skin of the foot healed without leaving any sign of the sludge discharge. The patient observed after 1 year there is no recurrency of corn again at the particular site. Conclusion. It can be concluded that Agnikarma is not only a successful treatment in treating corn, but also there is no recurrency again. Now, introduction. Corn is mentioned under Shadra Yoga by Acharya Shushruta. The employment of numerous treatment to treat Shar has been supported in Ayurveda and Agnikarma has been emphasized for its effective management. Agnikarma is mainly invasive therapy that leaves no scar and has no recurrence and has been reported to be more efficient in the treatment of corn. Agni was said to be the superior to the most Anushastra because of its quick results and long-lasting treatment. So Agnikarma is mentioned best of the corn. Symptoms of the Kadar which are mentioned in the classical Ayurvedic text resembles with corn in the modern science. Corn is mentioned by Shushrutacharya in Nidan Sthan. They further mentioned it cause as due to walking with the bare foot causing direct contact with the ground may cause injury by stone, or there may be injury to the foot by the corn. Wearing the shoes have nails or in surface causes injury to the foot. Pathophysiology of corn due to cause mentioned above this, there is dosha prakar, which leads to Rakta Meda Dhatu Drushti. Vitiated dosh cause very hard skin structure over the foot, like the gathis known as the kadar. Furthermore, Acharya have stated that there is a small round raised bump of hardened skin surrounded by irritated skin. It is painful, which worsen while walking. It may be having collection of fluid in pain increase after touching. As mentioned by modern science, corn is localized hyperkeratosis of the skin. It usually occurs at site of pressure, on example of sole and toes. There is usually a horny in the duration of the cuticle with a hard center. Corn may be painful when it is rubbed. Corn has tendency to reoccur after excision. A corn has a deep central core which reaches the deeper layer of the dermis. Treatment preventive only. Use soft or shoes padded or pressure points of the sole. Salicylic acid in the colloid on successive night may be applied. Central local application have been effective, such as corn acne or corn cap. It measure in if this measure fails and the corn is painful, it should be excised with particular care to take from the deep root of the central core, which prevents recurrency. As there is no specific treatment for corn by modern science, so present case study of Agnikarma in management of Kadar was chosen. Now, I did a patient information, patient name XYZ, gender 45, female, resident in Patur, attended an ROPD. Chief complaint was pain, Padarshul while walking. Past history, patient took treatment for the same, but there was no any relief. Therefore, she came to OPD for the further management. Past history, patient had injury to the foot by stone 1 year back. Then the treatment for the same. Then she developed a corn at particular site, having pain at the site, so came from the treatment. No history of hypertension, diabetic mellitus, asthma, or systemic disease. No any family history. No any physiological history. Clinical finding, physical examination, patient was normal, but there was all vital sign normal. No any other deformities. Local examination, inspection, palpation, diagnostic assessment done. Internal Raktapachak and Medapachak medicines for 3 months, external Agnikarma by Loha Shalaka for 3 days repeatedly, followed by application of sesame oil. The results were quite after 3 months, no any recurrence. Even after 6 months, no any recurrence. So discussion, patient was suffering from corns in 6 months, but last 1 month pain is worsened during walking, and she was taking specific treatment by modern medicine other than preventive, but no relief. Patient came to Ayurveda for treatment, as so have no recurrence of disease. As knowing disease pathology, we planned for Agnikarma treatment, and under all aseptic precautions, Agnikarma was done. It is with the help of shalaka, which was heated till it becomes red hot and placed over site of corn till tissue of site burned. Shalaka was reheated whenever required and applied over the site until samyak dagda lakshana appears, that is appropriate Agnikarma symptom. That is, it will appear like tala, teal fruit, black, or wound will not be much deeper, and pain reduction is there. Agnikarma will not cause any bleeding or controls infection, which with all these precautions, can't remove completely with its root, and there is no recurrency observed in the patient. Conclusion: Agnikarma is easy, safe, and cost effective for the patients to tolerate. There is no any complication like recurrence. Therefore, it can be concluded from the study of Agnikarma that Agnikarma is not only effective for treating corn, but also a prevents the recurrency. Thank you.
Thank you, Dr. Pranita. Thank you for the paper presentation. Next is a poster presentation on the topic renal calculi prevention and treatment methods, presented by Dr. Pranita.
Good morning, everyone. Myself, Dr. Pranita Pradeep Chandgude, third year resident from Vandanatai Gramin Ayurved Mahavidyalaya. My topic today for poster presentation is renal calculi and diet and management of it. So basically, first I would like to say you about kidney stones. What are kidney stones? Kidney stones are hard deposit made of material and salts that form inside your kidney. Diet, excess body weight, some medical conditions, and certain supplements and medications are among the many causes of kidney. So basically, what is the diet we can do for kidney stone is we have to take a yogurt, papaya, then water. We have to consume lot of water with lemon, coffee, green tea, bananas, any red, raw, and yellow pepper. Secondly, what can we avoid? Things to avoid is sugar and salt food, more than 500 of calcium, 500 grams of calcium, 200 units of vitamin, 2000 units of vitamin D, and 500 mg of vitamin C. And then we have to see cold cuts and other processed meals and grape food. Avoid high oxalated foods such as peanuts, nuts and seeds, beans, wheat bread, black tea, dark chocolate and cocoa powder, raspberries, beetroots, and potato. So basically, what is the management of urinary system? For renal calculi, we have medical conservation, extracorporeal shock wave, precut nephrotomy, PCNL, and open surgery. And for urethric calculi is the medical conservation and intervention. Then urinary bladder calculi, cystoscopic lithoplexy, and open surgery. And for urethral calculi, is prostatics, membrane and bulb, perineal, and false navicular or meatomy. By saying this, I would like to conclude. Thank you.
Thank you, Dr. Pranita Pradeep. Thank you for the presentation. Next, we go to the Ayurveda drugs on psoriasis related poster presentation. I would like to invite Dr. Vishnu Vasant Medkar for the poster presentation.
My name is Vishnu Vasant Medkar, PG Scholar of Dravaguna Vigyan Vibhag, JC Nanded. My guide name is Dr. S.S. Shakokar, Professor and HOD of Dravaguna Vigyan Vibhag, JC Nanded. I am presenting the role of Ayurvedic drugs on psoriasis with special reference to Eka Kushta Chikitsa. Introduction. Psoriasis is a common dermatologic disease with symptoms like pain, stiffness, dryness, and voids, spreads, lesions, and plaques with silver scales. Psoriasis can be occur or exacerbated by specific pathogenesis, including bacteria, Staphylococcus aureus, and Streptococcus pyogenes, virus, and fungi. The prevalence rate of psoriasis is 0.44 to 2.8% in India. The Ayurvedic treatment provides long-lasting results and better life for patients. So, the most common and effective medicine herbs are like, for example, amalki, haridra, and khadir, and any others drugs are also. The present review present the role of some important plants used in traditional system of medicine in India for the management of the Eka Kushta Chikitsa. Cause of the disease. विरुद्ध अन्नपानानि द्रव स्निग्ध गुरुणीच विताम गुरुणम धर्षयतम पाप कर्मम च कुर्वताम. इसका रेफरेंस चरक चिकित्सा अध्याय क्रमांक 7 श्लोक 4-8 में आया है. पैथोजेनेसिस संप्राप्ति वातादि स्त्रयो दुष्ट त्वच रक्त मांस अंबुंच दूषयन्ति स कुष्टाणा सप्तको द्रव्य संग्रह. इसका रेफरेंस चरक चिकित्सा 7-9 में आया है. मीन्स दोष दोष त्रिदोष वात पित्त कफा और दुष्य 4 दुष्य है इसमें. त्वक रक्त मांस लसिका इनका प्रकोप त्रिदोष प्रकोप होता है. प्राधान्य से कफ दोष को प्राधान्य से बढ़ता है. शरीर सर्वत्र इसका संचार होता है. फिर दुष्य कौन से? त्वक रक्त मांस लसिका. इनसे शरीर में पूरे शैथिल्य और उनकी दृष्टि होती है. फिर दृष्टि होने के बाद क्लेद की उत्पत्ति होती है. फिर इसके सिम्टम लक्षण क्या दिखाई देते हैं? त्वचा आदि ठिकानों से कोत निर्माण होते हैं और उसको ही कुष्ठापुन बोलते हैं. टाइप्स इसके टाइप बोले हैं. अतः ऊर्ध्वम अष्टादशाणाम कुष्ठाणाम एक कुष्ठ. चरक चिकित्सा 7-13 में इसका रेफरेंस आया है. कुष्ठ के प्रकार बोले तो महाकुष्ठ 7 है और क्षुद्र कुष्ठ 11 है. सिम्टम्स इसके लक्षण क्या है? अस्वेदनम महावास्तु यन्मत्स्य शकलोपम तद एक कुष्ठम. चरक चिकित्सा 7-21 में इसका रेफरेंस आया है. अभी दोष इसका दोष प्राधान्य क्या है? तो चर्माक्षम एक कुष्ठम न्यायम कायो वात कपारिकम. चरक चिकित्सा 7 श्लोक क्रमांक 29 में इसका वर्णन है. अब इसकी चिकित्सा में कई ड्रग बोले हैं कुष्ठ के लिए, लेकिन महत्वपूर्ण जो ड्रग है वो ये है आमलकी, हरिद्रा, खदीर. और आमलकी का लैटिन नेम एमिलिका ऑफिसिनेलिस. फैमिली इसकी पूर्वेसी है. गण कौन सा इसका? वयस्थापन विरेचनोत्पन्न गण में आया है. रस अम्ल प्रधान रस है इसमें. विपाक मधुर है इसलिए वीर्य शीत है. अब हरिद्रा टर्मिक लैटिन में करकुमा लोंगा. फैमिली जाय जिंजिबेरेसी फैमिली है. गण कंडुग्न कुष्ठग्न बोला है. विपाक कटु है, उष्ण है. रस तिक्त कटु है. खदीर कच ट्रिप इसका बोला है लैटिन. इसका लैटिन नेम एकेसिया कैटिचो. फैमिली लेग्यूमिनेसी है. इसका गण कषाय कंडो है. रस तिक्त कषाय है. कटु और शीत बोला है. इसकी संप्राप्ति कैसे है? तो आमलकी की देखेंगे. अब कषाय प्लस वृक्ष से क्लेद का शोषण होता है और कुष्ठग्न बोला है. तो वीर्य शीत है प्लस मधुर रस है, कषाय तिक्त रस है. इससे रक्तगत पित्त में जाता है. फिर उष्ण और तीक्ष्ण गुण से इसका शमन होता है. रक्त प्रसादन कार्य करता है और त्वक प्रसादन होता है. फिर इसमें टैनिन, फ्लेवोनॉइड्स ये कंटेन है एंड और ये एंटीऑक्सीडेंट प्रॉपर्टी यूजफुल इन सोरियासिस. हरिद्रा तिक्त रस वाला है. तिक्त रस रक्तगत क्लेद का पाचन करता है और वर्ण्य कार्य करता है. तिक्त रस और कटु विपाक और उष्ण गुण से रस, रक्त, मेद, धातु धातु मांद्य आदि का ये बोल के इसको कुष्ठग्न बोला है। और खदीर 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 कषाय और शीत है। श्लेष्म श्लेष्मधरा संकोचक स्तंभन और स्तन्य श्रावण्य बोला है। कषाय तिक्त रस और कटु विपाक और शीत वीर्य। कषाय तिक्त रस और कटु विपाक से रक्तगत मेद का क्लेद और शोषण करता है और कुष्ठग्न बोला है। अभी कंक्लूजन, एक कुष्ठ सोरियासिस इज अ वातकपजन्य रक्त प्रदोषज व्याधि है। इट इज द नीड of time to find the outset and efficacy treatment of Eka Kushta, and here Ayurveda is a ray of hope of in such in health condition. Above the explained three drugs imparts effective use in Eka Kushta Chikitsa, mainly Tikta, Katu, Kashaya, Ras, Katu, Vipak, Virya, Ushna, and Lagu Ruksha Gum are useful in Eka Kushta Chikitsa. धन्यवाद।
Thank you, Dr. Vishnu Medkar. Thank you for the nice presentation. Next is the study of Viruddha Aahara and its contemporary significance, a review. I would like to invite Dr. Rupali Nagnathrao Patil for the paper presentation.
This is Father of Krishna Shali Department, Government Ayurvedic College, Dharashi. My guide is Dr. N.K. Dowdeman, HOD Professor of Krishna Shali Department. My topic name is Conceptual Study of Viruddha Aahara and its Contemporary Significance, ADV. Acharya Charat has mentioned Viruddha Aahara in Sutrastham 26th chapter. Viruddha Aahara differs in terms of food, food interaction, food processing interaction. It clearly defines that certain diet and its combination, which interrupts the metabolism of the tissue, which inhibit process of formation of tissue. In current scenario, every one of us is enjoying the taste of junk food because it is delicious, affordable. As per Ayurveda, junk food can be considered as a Viruddha Aahara and incompatible food. A conceptual study of Viruddha Aahara and its contemporary significance, objective, to study the effect of Viruddha Aahara on health, to find relation of Viruddha Aahara and junk food and health disorders. Methodology. Literature has been reviewed from both Ayurveda and contemporary science. There are the 18 types of Viruddha Aahara mentioned in Ayurvedic literature. These types of food combination not used in today. Viruddha Aahara can lead to inflammation at a molecular level. 18 types of Viruddha Aahara as follows. Desh Viruddha means intake of dry and sharp substance in desert. Kal Viruddha means intake of curd at night. Agni Viruddha, for example, eating big meals while having anorexia. Dosh Viruddha, Vat Prakriti person taking Pavarta. Virya Viruddha, fish and milk. Koshti Viruddha, constipated person taking purgatives in less quantity. Krama Viruddha, for example, intake of food without clearance of bowel. Parihar Viruddha, consuming cold water after taking tea. Pak Viruddha, eating raw food like non-veg. Upachar Viruddha, for example, taking cold things after taking ghee. Samyog Viruddha, for example, fruit salad. Riddhi Viruddha, intake of unpleasant food. Vidhi Viruddha, eating food in public place. Avastha Viruddha, intake of Vata aggregating food after exercise. Sanskar Viruddha, heated madhu. Sampad Viruddha, eating undried food. Satmi Viruddha, for example, having it. Matra Viruddha, for example, honey and grease in equal quantity. Some common Viruddha Aahara in day-to-day lives are milkshake, fruit salads, means rasa and video Viruddha. Popcorn with a watching movie, means Matra Viruddha. Popcorn along with a cold drink, Vidhi Viruddha. Cold water or soft drink before hot tea. Koshta and Agni Viruddha. There are the disease occur due to the Viruddha Aahara are as follows. Shandya, causation of sterility, Anidha, blindness, Visarpa, herpes, spreading types of skin diseases. विस्फोट, उन्माद, भगंदर, fistula, मूर्छा, मद, अधमान, गलग्रह, pandones, anemia, amavisha, poisoning due to ama, kilas, a type of skin disease, kushta, skin disorders, grahani, amlapitta, ज्वर, peaners, sadhana dosha, mrityu. There are some diseases occur due to the Viruddha Aahara. Treatment of Viruddha Aahara, the Nidan Parivarjan is the best way to live a healthy life. After this, some purification therapies like Panchakarma, Burman, Virichan, Basti, palliative therapy, Shaman Chikitsa, and take a wholesome diet. Discussion. Charak has been enlisted 18 types of Viruddha Aahar in Ayurveda, Nitya Aahar, Adhyashana, Vishamashana, Atyashana. These terms included in Viruddha Aahar. Prevention is better than cure, so our responsibility to take prevention of this toxicity in community. First, ban on advertisement of junk or fast food because children get attracted to these foods. Conclusion. Healthy food habits should follow day-to-day life. Proper exercise, meditation, yoga, or doing work and avoid overeating. Follow Dincharya and Ahar Vidhi, Visheshayatan that explains in Ayurveda. Thank you.
Thank you, Dr. Rupali Nagnathrao Patil, for the wonderful presentation. Next is a Rasayan Chikitsa for Ojovikruti in Madhyajanya Vigara. I would like to invite Dr. Nanda Manohar Dhabadkar for the poster presentation.
Good afternoon, everyone. Myself, Nanda Manohar Dhabadkar, PG second year student of Agatantra department from GSC Dharashu. Here I am going to present the Rasayan Chikitsa for Ojovikruti in Madhyajanya Vikara. There is no directly reference of Rasayan Chikitsa in Madhyajanya Vikara. Here I am going to explain how it will be effective. Firstly, we will see the pathogenesis of Madhyajanya Vikara. Excessive consumption of alcohol, it causes vitiation of Ojas Guna. Then distortion of Hriday, Man, Buddhi, Sattva and Indriya, then Manovikshop, Smriti Vibransh and deterioration of Sattva Guna, and develops Madhyajanya Vikaras like Mad, Murcha, Madate, Apasmar, Unmad, Apatanak, Shok, Bhay, Krodh. We know that Madhya's Guna are exactly opposite to the Oja's Guna, hence Madhya causes Vikshop of Oja. Like Logo Guna causes Vikshop of Guru Guna, Ushna Guna causes Vikshop of Sita Guna, Amla Guna causes Vikshop of Madhur Guna, Tikshna Guna causes Vikshop of Mrudu Guna, Ashu Guna causes Vikshop of Prasad Guna, and so on. Hriday is the sthana of Oja and hence causes distortion of Hriday and reduces the other dhatus like Man, Buddhi, Indriya, and Rasadi dhatus. On the basis of application of Oja, there are 3 stages of Madha. In which first stage there is no application of Oja, in which second stage there is mild application of Oja, in third stage Oja is applied more. We know that the Oja is essence of Saptadhatus and Rasayana is the treatment by which we can obtain the Sreshta Saptadhatus. Thus this will help in obtaining the good quality of Oja. Rasayan Chikitsa also increases Sharir Bal, Manobal, Indriya Bal, Medha, Buddhi, Smriti, and it improves Vadishamatva, Swar, and Varna. And Oja is nothing but the Sharir Bal, Manobal, Vadishamatva, Saptadhatu Sar. Hence, Rasayan Chikitsa will definitely help in improving Ojas. Also, there is a reference of Rasayan Chikitsa in Ojo Vapat and Ojo Visrans in Susrut Sutrastan, 15th Adhyay. Now we will see the some definition of Oja, Rasayan and Ojo Vapat and Ojo Visrans Chikitsa. Definition of Ojas. तत्र रसादीनां शुक्रान्तानां धातूनां यत् परं तेज तत्र खलु ओज तदेव बलम् इति उच्यते स्वशास्त्र सिद्धान्तात्. Definition of rasayan. लाभोपायो हि शस्त्राणां रसादीनां रसायनं चरचिकित्ससां second at the 8th श्लोक. नंतर चिकित्सा ऑफ ओजो व्यापत आणि ओजो विसरंस. तत्र विसरंसे व्यापन्ने च क्रियाविशेषे अविरुद्धे बलम् अप्यायते इतरं तु मूढसंज्ञं वर्जयेत्. शुश्रूषसूत्रस्थान 15th अध्याय 28th श्लोक. Now we will see the Rasayan Chikitsa. There are 3 types of Rasayan Chikitsa: Kamik Rasayan, Naimittik Rasayan, and Ajasrik Rasayan, from which Naimittik Rasayan and Ajasrik Rasayan we can use in Madhyajanya Vikara. Naimittik means the Rasayan Chikitsa, which is used for prevention and treatment of disease. There are so many Rasayans which we can use according to the sign and symptoms of the patient. Kamik Rasayan means the Rasayan Chikitsa which is used for the desire of pran, meda and stri. Ajasrik Rasayan means the food which is used on the daily basis for the nutrition, like Dugdha and Ghruta. Dugdha and Ghruta both helps in Ojovikruti. Dugdha is a Sreshta Jivaniya Dravya, hence the Sreshta Rasayan also. And Ojovikruti because Dugdha's 10 guna are same as the Ojas guna. Ghruta is also Ojovikruti, Medha Vruddhikar, Agni, Buddhi and Smruti Vardhak. Now conclusion. Rasayan Chikitsa is effective in Madhyajanya Vikara by enhancing the quality of Saptadhatu, Smruti, Buddhi, Indriya Bal and ultimately enhancing the quality of Ojas. Thank you.
Thank you, Dr. Nanda Dhabadkar. Thank you for the presentation. Next is an interesting topic. Padya and Apatya Ahara in thyroid disorders. I would like to invite Dr. Mansi Dinesh Ketkari for the paper presentation on the topic Exploring Padya Ahara in thyroid disorders.
Hello, myself Dr. Mansi Gadkari. I am a PG scholar in Agattantra department doing PG in Government Ayurvedic College, Dharashiv, Maharashtra. My topic name is Exploring Pathya Apathya Ahar in Thyroid Disorders. Basically, in Ayurveda, Trayopstambha were mentioned, that is Ahar, Brahmacharya and Nidra. The basic need is food, that is Ahar, as it refers to essential nutrients that our bodies require for survival, growth and good health. This includes carbohydrates, protein, fats, vitamins, minerals, waters, fibers, etc. If these nutrients are imbalanced, many diseases or disorder may happen. So it is very important nowadays to fulfill it with our diet. So there is my aim to achieve basically thyroid disorder, as it is a lifestyle disorder, and today's prevalence rate of thyroid diseases were increasing day by day, while there is 2 types of thyroid, hypothyroidism and hyperthyroidism. Hypothyroidism is 10 to 15% percentage of prevalence rate in certain population, while in hyperthyroidism 1 to 2% population globally were adapting these diseases. So mainly causes like thyroid nodules. These are the common cause, majorly in older adults, 50 to 70%, while thyroid cancer are 1 to 2%. Some areas like iodine deficiency area, while some areas like high iodine intake. Sometimes gender is also mainly females are more prone to the male as during the periods of hormonal changes, while in thyroid, T3 and T4 are these two main hormones which are important to regulate the metabolism function of the cells. While the decreasing the level of TSH, it may leads to hyperthyroidism. While decreasing the level of TSH may cause the hyperthyroidism, while increasing the level of TSH causes hypothyroidism. So mainly symptoms are like in hypothyroidism, weight gain, slow metabolism, constipation, fatigue, dry skin. While in hyperthyroidism, weight loss, fast metabolism, nervousness, irritability, muscle weakness, brittle skin, and trouble sleeping. These are the main sign and symptoms were seen. So by using Ahar concept, we can prevent the further complication in patient, or we are preventing the diseases. As per Ayurveda, we can correlated thyroid disease or disorder with the Galganda Vyadhi, which are mentioned by our acharyas. Galganda Vyadhi is nothing but the Mans Pradoshaj Vyadhi. So there must be came with the Abhishandhi Ahar, Diva Swap, etc. So we need to eliminate the cause of thyroid, that is Nidan Parivarjan. In thyroid or we say Galganda Vyadhi, Vat and Kapha are the main dosh were getting violated, while Rasa Dhatu also get violated. Main treatment we can give is our Rasa Dhatu, that is Langhan. It is a type of fasting in which it maybe reduces the excess formation or arm, which is the main cause of the any diseases. So our acharya made easy with the giving some ashta ahara vidhi vishayatana or dwadash ashayatana, which are very useful for doing pathyas, which helpful for preventing or curating purposes. So as my topic is thyroid disorder, I can explain in hypothyroidism and hyperthyroidism, which is pathya, which can be taken or which can be which can be a pathya. So in hypothyroidism, we always take a fresh food, which is warm, nourished, whole grain, healthy, fatty foods, iodine rich, like a fish, which support the thyroid, selenium and zinc, nuts, seeds, legumes, which are the thyroid hormone production increases, goitrogenic food, which is limit raw vegetables like broccoli, cabbage, they can interfere with the thyroid function. So we can take this food in hypothyroidism, while in hyperthyroidism, cooling foods, the option is for fruits or green leafy vegetables, dairy products to balance the excessive heat. High calorie food, as in hypothyroidism, weight loss is given, or weight loss is happen. That's why some herbs like adaptations, like ashwagandha, which are balya, are pathya in hyperthyroidism. While some other pathyas like bottle ground, beet, lady fingers, then dodka, all types of beans, green leafy vegetables like tandurja, green mart, red mart, spring onion, green gram, that is mug, which are very laghu and very sapmev for us, lentils, fresh buttermilk, fresh coconut, onion, garlic, seasonal fruits are pathya, boiled eggs, 1 glass of cow milk, and some apathyas like Viruddha Aahara, 18 types of Viruddha Aahara were given. So that will be also included in this. Cauliflower, cabbage, as it is a goitrogenic substances, so it may be apathya. Spinach, fenugreek, that is methi, matki, pauta, bakery products, curd, fermented food, or groundnuts. These all are apathyas. In hypothyroidism, some processed food, as it contains high sugar, unhealthy fats, and which exacerbate the inflammation and hormonal imbalance. Soya products, which are interfering the thyroid hormone production if very consuming excessively. High sugar foods can lead to energy and crashes and further metabolic imbalance. So while in hyperthyroidism, which are like stimulants like caffeine or other exacerbated symptoms like anxiety and restlessness, while spicy food also prohibited as it increases the heat and potentially aggravates the hyperthyroidism. So these were very useful for the preventing the diseases or not getting any complications by doing Nidan Parivarjan and doing the Pathya Ahar in our diet. Thank you.
Thank you, Dr. Thank you, Dr. Mansi Gadkari. Thank you for the wonderful presentation. Next is a scalp psoriasis management related paper presentation. I would like to invite Dr. Shubham Bhagwan Jugnage for the paper presentation on the topic Ayurvedic management of scalp psoriasis, a case study.
Hello everyone, myself Dr. Shubham Jugnake, PG Scholar, Agnikarma Department, Government Ayurvedic College, Dharashi. My topic name, Ayurvedic Management of Scalp Psoriasis, a case study. Introduction, psoriasis is a long-lasting, non-contagious autoimmune disease characterized by patches of abnormal skin. The rate of psoriasis varies according to age, region, and ethnicity. A combination of environmental and genetic factors is thought to be responsible for this difference. The 5 main types of psoriasis are plaque, defect, inverse, fistula, and erythroderma. Plaque psoriasis, also known as psoriasis vulgaris, make up to 90% of death cases. The plaque psoriasis typically appears as a rosy area of inflamed skin covered with silvery white skin. These areas are called plaques and are most commonly found on elbows, knees, scalp, and back. After that, affected by psoriasis, up to 80% will have involvement of the scalp region. The scalp psoriasis is characterized by red, thickened plaques with silver white still either contained within the hairline or extended onto the forehead, ears, and posterior neck. Eka Kushta, which having a symptom like scalp psoriasis, has been described previously by Acharyas in Saitha. Acharya Charak has mentioned the symptoms of Eka Kushta as Shayam, Kinithorus, Parsha, Purusham, Kiturum, Smitham. The etiologic factor leads to violation of 3 doshas, especially Vata and Kapha. Dosha and Tvacha, Lasika, Rakta, Mansa are the 7 major causative factors for Kushta. Please report basic information having a male patient of 60 years, religion Hindu, occupation labor, प्रधान वेदना क्षीरप्रदेशी कंदू क्षीरप्रदेशी लालिमा क्षीरप्रदेशी त्वक व्यवहार क्षीरप्रदेशी त्वक रुक्षता क्षीरप्रदेशी कंदू एंड लालिमा मणिप्रदेशी कंदू एंड लालिमा all about the symptoms were present since 2 years. Vartaman Adhiputtan, the male patient having age 16 years had came to Panchakarma OPD with OPD number 8176. He was having other complaints since 2 years. He was treated with some modern medicine, but according to patient, the symptom was curing only when the treatment was going on. As the treatment stopped, the reoccurrence of the symptom was occurring. So for further management and the treatment, the patient was taken in Panchakarma OPD in Government Ayurvedic College and Hospital, Dharashi. Maharashtra. Purva Vaidurthat, no any past history of illness, goes with the any illness present in the family members. Vaitik Vruttha means personal history. Patient was addicted to the both tobacco and alcohol since 20 years. Was addicted to gutka chewing. Patient was consuming both the veg and non-veg. On examination, general examination was fair, temperature and febrile, vitals normal, CVS and RS were no deformities, CNS conscious, well and oriented. अष्टोत्तर परीक्षा नाड़ी कफ प्रधान वात रेट ऑफ 76 पर मिनट मूत्र प्रकोप मल मलबद्धता जीवा साम that is कोट शब्द स्पष्ट स्पर्श वृक्ष and समशीतोष्ण दृक् that is eye प्राकृत आकृति मध्यम. Other examination scaling and itching present on the scalp region, back of the neck region and the shoulder region. Diagnosis present. Patient was previously diagnosed as psoriasis, but according to the Ayurveda, after proper clinical history and the examination, patient was diagnosed as a Eka Kushta. Treatment for Dipan Pajan, the patient was treated with Ampachikoti, 2 tablets twice a day before food, Anuloma with Gandharva 2 tablets bedtime for 3 days, Arabat for Majapat for Snanartha or hair twice a day, Karanjatil for local application twice a day after snan. After treatment, patient was treated with the following medicine. First, Aragyardhini 2 tablets daily before the food, Rasayan 1 tablet before daily after food, Vishwashari 1 tablet daily after food, Mahamajistadikwat 20 ml daily before food, Aragyod Kapilavati 1 tablet bedtime, Arabat Falamajakwat for Snanat or hair twice a day, Karanjatil for local application twice a day after snan. Patient was called for follow-up after 7, 14, 21 days. After 21 days treatment, patient maximum symptom was being recovered. Patient was happy and satisfied with the treatment. This is passes score before treatment. The passes score before treatment was 7.2, and these are the images before the treatment. So after the 21 days, the passes score was measured, and the passes score was total 0.1. And these are the images of the after treatment. The result and discussion. The psoriasis is a long-lasting, non-contagious autoimmune disease characterized by patches of abnormal skin. Modern medicine for the cure of psoriasis has its own side effects. After a long term of use, as symptoms like disease have been described by Acharya Ayurveda, it is correlated with Eka Kushta, type of Shudra Kushta. Eka Kushta having dominance of Vata Kapha dosha. The Vata dosha reaches to the Shithila dosha like a toka. It is and result into the stan sensory avastha and the produces symptom of Eka Kushta. Acharya Charak says that Kushta Shithilta is present in whole toka. It having the parush dryness, incur sponsor that is rough skin, shavato that is blacky skin. In Ayurveda management, we use Argyodinimati as Aragya means good health and Vardhini means improvement. It means it improves the good health of the body. It is used for Kushta, Varus, Shoto, Madharoga, Kamla, and other Yakrut Vikar. Kandakrasa is a classical drug. It's blood purifier. It has antioxidant and anti-inflammatory property. Bushashar already used as there may be some environmental poisonous activity which affect the skin, leading to the infectious to that. Manustabik act as a blood purifier. It helps clean the blood and remove the toxins from the body. Arabic Kapila works as smooth bowel regulation and also mild nervous action without spasm. Arabic is mentioned as a pushpamon. So Arabic Kalamajachurn is the first name after. Kanzatul is a blood purifier and is effective for pimples and other skin eruption. Other treatment is given for 20 to 21 days and the results are more satisfied with the patient. In conclusion, this case showed that the psoriasis can be cured with Ayurveda. No adverse effects are noted during the treatment. No new symptoms were found in patient. Patient was satisfied by Ayurveda. Thank you.
Thank you, Dr. Shubham Jugnage. Thank you for the paper presentation. Next is sciatica management related paper presentation. I would like to invite Dr. Reshma CR for the paper presentation on the topic effective management of sciatica with combination of Vaidarna Basti and Majja Basti.
Respected dignitaries and all those who are present here, I'm Dr. Reshma Siyar, third year PG scholar from Department of Agat Tantra from Government Ayurvedic College, Dharashiv. I would like to present the topic on effective management of sciatica with a combination of Vaidyanavasti and Majjavasti. Coming to the topic, sciatica refers to pain that travels along the path of sciatic nerve. The sciatic nerve travels from the lower back to the hips and buttocks and down each leg from L4 to S3 segment. Sciatica most often occurs when a herniated disc or an overgrowth of the bone puts pressure on the part of nerve. This causes inflammation, pain, and often some numbness in the affected leg. According to Ayurveda, this condition can be correlated to Gridrasi, in which pain radiates from the low back to lower limb and patient walks like a vulture, that is Gridra. Stages of disc herniation. This is a very basic stages which everyone knows. I need to briefly tell about the terms here, like normal disc, degenerative disc, bulging disc, herniated disc, and thinning disc. Then coming to the clinical features, age is common in young and middle-aged people doing strenuous works. Signs include muscle wasting, motor weakness and sensory impairment, bladder and bowel involvement, diminished deep tendon reflexes. Symptoms includes low back pain, referred sciatic pain, paresthesia, tingling numbness in the lower limbs. And the surgical management of the condition is laminectomy and discectomy. Case report. A 35-year-old male patient came to the Panchakarma OPD with pain over low back region, pain and tingling sensation over left lower limb, inability to walk properly, it is andalgic gait since 8 days. History of low back pain before 2 years, no history of diabetic mellitus or hypertension or any musculoskeletal disorders, no any specific personal or drug allergies. And examinations include Ashtavida Pariksha was done, and Nadi, Mutra, Mala, Jihva, Shabda, Sparsha, Drika, Agradi was done briefly. And Nadi includes 72 per minute. Sama, Mutra, Anavila, Mala, Avabadda, Jihva, Sama, Shabda, Spashta, Sparsha, Anushna, Sheda, Drik, Pragrita, Agridi, Madhyam. And inspection of lumbosacral spine concludes that there is no evidence of swelling, tumor, redness, etc. No evidence of deformity like kyphosis, lordosis, or scoliosis. Flexion of the spine and extension of the spine was painful. And palpation was noted like tenderness at L3, L4, L4, L5, and L5S1 segments. And pain radiating down in left lower limb on pressure. Examination of the both lower limb concludes like SLRT, straight leg raising test, was 90-degree painless at the right limb, whereas 30-degree painful at left lower limb. And Lasik sign was negative on the right limb, whereas positive in the left limb. And sensory impairment was not noted in both the limbs, and motor power having grade 5 in the right limb, whereas grade 4 in the left limb. And angle extension and angle dorsiflexion was normal in the right limb, whereas weak in the left limb. And muscle wasting was not noted in both the limbs. And deep tendon reflexes include plantar reflex was normal in both the limbs. Angle jerk was diminished in the left limb, whereas normal in the right limb. Knee jerk was also normal in the right limb, whereas diminished in the left limb. And Chikitsa. Chikitsa mainly aims at 4 stages. First, Dibana Pajana to reduce the Amatva and also to reduce the Kabavarana. So Vaidyanavasti was the better option. So Vaidyanavasti was given to the patient for 7 days. Like Acharya Charaga said, Pala Shukti Karsha Kudavai Ramli Guda Sindhu Janmaha Gomutrehi Tailayudu Ayam Vastihi Shulanaha Ama Vadahara. So Vaidyanavasti was mainly aimed at reducing the acute pain due to amatva and also to remove the kabavarana from the area. So after Vaidyanavasti, we plan for Sarvanga Snehasvedan with Danandar Tel, and locally Snehasvedan like Kadi Vasti was also given to the patient with Danandar Tel. Sarvada Sarva Bhavanam Samanyam Vriddhi Karanam Rasa Hedu Visheshasya Pravarti Rubhayasya tu. Then Kala Vasti was planned to the patient, a 15 days Vasti. First done with the Kashaya with the Ryuhavastiyas Dashamula Kwada, then followed by 3 Majjavasti for about 100 ml after morning meal. Then followed by 1 Niruhavasti, then 3 Majjavasti, like that 15 days Kalavasti was given to the patient. as the Acharya Charaga said, Gramya Anubha Udaganam tu Bitwa Asthini Pache Jale, Tam Sneham Dashamulasya Kashayena Punapaje, Jivaga Rishabaga Spoda Vidhari Kapi Kachubihi. Like that Majjavasti, after 15 days of Majjavasti and Dashamula Kwada Niruhavasti, patient feel better. Then observations are on the first day, the pain was about 5 plus and tingling sensation was also about 4 plus and SLRT was 30° on the left limb. After 7 days, we noted that the pain reduced to 4 plus and tingling sensation also reduced to 2 degrees. Then SLRT pain was only at 45°. And on 21st day, pain gradually reduced to only 2 plus, only mild pain, and tingling sensation was also reduced to 2 plus. And SLRT, he can able to raise his leg up to 60° and only mild pain on the left limb. And on the 28th day, it was noted that there is no pain and no only very mild tingling sensation, and patient can raise the leg up to 80° with only mild pain. And discussion: due to Sterner's work, Dadukshaya leads to degenerative disc changes with the nerve compression and tingling sensation and radiating pain. Vada Koba associated with the Kabha Varana causes Kridrasi, that is Vada Kabha in nature. So this is the video of before and after treatment in the patient. The first video was on the day of admission and the second video was on the day of discharge. Then coming to the conclusion, according to Ayurveda, this is considered to be a case of Vridrasi. Vada Koba associated with the Kabha Koba, required Kabha Shamana and Vada Shamana followed by Dadu Poshana is to be given. So Vaidaranavasti relieves Kabha Vrida Vada and Majjavasti do Dadu Poshana in Kevala Vada. Combination of Vaidaranavasti and Majjavasti effectively treats neurological impairment and saves the patient from surgery. This is all about the clinical management of sciatica effectively with the Panchakarma therapies. And thank you.
Thank you, Dr. Reshma, for the wonderful presentation. Thank you, Doctor. Next, I would like to invite Dr. Aishwarya Bhor for the paper presentation on the topic Review on the Haridra and its antitoxic effect on the skin.
Hello everyone, myself Aishwarya Bhor, PG Scholar, Department of Agat Tantra, Government Ayurvedic College, Dharashaw. My presentation topic is a review on the Haridra and its antitoxic effect on the skin. In human skin, the outer covering of the body is the largest organ in the body. It also constitutes the first line of defense. When we consider the prevalence of various diseases every year, worldwide, near about 20% of the total number of patients seeking medical advice suffer from skin diseases, including cosmetic problems. Skin diseases is a common nowadays and it affects all ages from the children to the elderly and causes harmful in a number of ways. Skin diseases affects not only on the somatic level but also on a psychological level. The function of Ayurvedic herbs is to purify skin and eliminate three dosha from the body, as they are mainly responsible for skin disorder and other diseases. In Ayurveda classics, there are so many Vishagna Dravyas. Among them, Acharya Charak has mentioned the 10 Vishagna Mahakashaya. Among various drugs used as a Vishagna, Haridra is one of the one of them, and also the component of Vishagna Mahakashaya. Aims and objective: to review the Ayurvedic and modern literature on Haridra, to study the antitoxic effect of Haridra on the skin. Haridra, Latin name Curcuma longa, English name turmeric, Sanskrit synonyms Yoshitpriya, Varavarnini, Krumigni, family Zingiberaceae, chemical constitution curcumin, terpene, cholesterol, starch, albuminoids, and volatile oil. हरिद्रा कटुका तिक्ता वृक्षोष्ण कफानुगत वर्ण्यत्वक दोष हस्त्र शोष पांडवा व्रणापहा गण चरकनुसार लेखनीय कंडुग्न विषग्न तिक्तस्कंद शिरोविरेचन सुश्रुतनुसार हरिद्रादी मुस्तादी श्लेष्म संचलन गुण वृक्ष लघु रस तिक्त कटु विपाक कटु वीर्य उष्ण part used of Haridra is rhizosome. Effect of Haridra: दोष कफवात शामक, पित्तरेचक, पित्तशामक, धातु रक्त मांस, स्रोतस रस रक्त अन्न. Haridra due to Tikta rasa specifies the Sam Pitta level in the body, but in Niram Pitta condition, better do not use it due to Ushna Virya. It may cause gastritis. Tikta ras, Katu Vipak, Ushna Virya controls the kapha. Haridra, Rasapachak. Haridra is used to digest the doshas from Rasadhatu by its stimulatory action on Rasagni due to its Tikta and Katu rasa. Haridra, Varnya. In skin complexions, due to Tikta rasa, Haridra purifies the Rakta Dhatu and it reduces the clay from it. It regulates the function of Ranjak Pitta and improves the skin color. Haridra in Tvakadushti. In skin diseases, Haridra also reduces the sweat by reducing the clay production. Hence, it is used in skin diseases where the oozing is prominent. Example, wet eczema, tinea crudaris. Haridra in Tvakadushti. Antiseptic. Haridra reduces the secretion from the wound and it shows antimicrobial action. Hence, it used in wound healing. Example, turmeric water is used for irrigation of wound. Haridra in Mukhadushika. In acne, Haridra is used with the milk from local application. Various herbal face packs contains Haridra as an ingredient. Haridra, Rakta Dhatu. Haridra stimulates production of Ranjak Pitta. All the enzymes and factors needed for erythropoiesis. It also stimulates metabolism of Rakta Dhatu by reducing the excess kleda. Due to purification of Rakta Dhatu, it improves color and complexions. Antitoxic action of Haridra. Haridra having Katuras, Laghu Gun, Ushna Virya and Katu Vipak, which related aggravation of Pitta with aggravation of Visha. But due to its Prabhava, Vichitra Pratyarabdha, it acts upon the Visha. Haridra reduces the aggravated Pitta dosha and related aggravated Dhatu. That means Rakta, which breaks the pathogenesis of accumulation of apachit Rakta Dhatu. Ultimately shows the action like Ushtagna and Vishagna. Haridra shows different type of mechanism. Various preparation of Haridra is Haridra Khanda, 5 to 10 gram OD or VD. Haridra tablet 2 VD. Marichadi tail used for external application. Mahatikta Grut, 1/4 to half tablespoon with water before meal. Mahamanjishtadi Kadha, 10 to 30 ml BD. Ashwagandharishta, 15 to 20 ml with equal quantity of water. Discussion. The toxins and toxicity of poison and its antidotes. have been mentioned from Vedic period. Due to use of different kind of junk food and lack of extra physical activity, there is accumulation of fatty and toxic substances. These substances loaded in subcutaneous tissue and also in different organ and srotas. Such type of toxins and fatty substances called dushivishan in Ayurveda. Conclusion: as Haritra, by its properties, which breaks the cyclooxygenase pathway, free radical scavenging, antitoxicant activity, anti-inflammatory activity, validates the antitoxic or antipoisonous effect. Due to strong potent Vishabhna activity, Acharya Charak may had mentioned this at first rather than other remaining Vishabhna drugs. Thank you.
Thank you, Dr. Aishita. Thank you for the wonderful presentation. Next is a Dadragushta related paper presentation. I'd like to invite Dr. Pranay for the observational study of etiological factors of Dadragushta with respect to ringworm infection. Dr. Pranay, are you there? Hello, Dr. Pranay, are you there? Hello, Dr. Pranay, are you there? Doctor, please unmute, doctor. We can't hear your voice. Please unmute, doctor.
Hello.
Hello, good evening, doctor.
Hello.
You are audible, doctor. Good evening.
Yes,
Can you hear me,
am
doctor?
I audible?
Yes, doctor. You're audible.
Yes, yes. Yeah. This is Dr. Pranay Godse from Kolhapur. I'm going to explain the Dadru Kushta and its observational study, provoking factor to it. There is introductory shlok is there. Adirga Pratana Durvadurasi Kusha Umavi Utsana Mandala Dadru O Kandu Mattenu Shangani. In this above shloka, there is description of Dadru Kushta, which is manifested linearly, distributed reddish discoloration that spreads quickly. These rash are around the shape, in shape, and cause itching. This condition may remain as such as a longer period of time. Near of study, ringworm affect 20%. That is Dadru. Dadru Kushta affect 20% of world's population, irrespective of a race of ethnicity. There is era of a beauty and glamour change in appearance caused by skin disorder affect person emotional and psychological well-being. In Ayurveda, pathogenesis of disease is explained with the help of the Nidan Panchaka, and the Nidan Panchaka Nidan plays an important role of disease introduction, production in this elimination of a cause will be lead to elimination of the disease. Hence, to find what is association between the Nidan Sevana and the Dadru Kushta, which affect the patient's emotional and psychological health, and for prevention of disease study and etiological factors, it's needed. Primary research. Primary hypothesis: the etiological factors mentioned in this text is responsible for development of the Dadru Kushta. There is another null hypothesis. Etiological factors mentioned in text are not responsible for development of the Dadru Kushta. In this review, the appearance of the Dadru Kushta Sakandu Raga Pidakam Dadru Mandala Drutam. A shape in the appearance Dadru Kushta presents which elevated circular patches comprising of itching, eruption, boil, sign, Ranga Pedika Mandalam, predominant symptoms, Kandu, dosha, predominance, there is a Pitta and Kapha doshas, Kandu, intense itching, and the Mandalam, the circular patches, which is red margin, and Pedika, eruptions in boil. The primary objective is just to study etiological factors of Dharaka Kushta. Secondary objective to study the Dharaka Kushta in details and study ringworm, which is associated with that methodology. The study design, location of study, and study duration is random, like college campus and all. And there is a OPD and campus patient, IPD patient, and duration of studies. Okay, it's okay. Uh, hello. There is sample of 100 patients will randomly take for this observational study. Inclusive criteria and the exclusive criteria is there. Inclusive criteria is patient diagnosed with Dharaka Kushta, age of group is 10 and 15, in between 10 and 50 years. Male and females both will be included. Exclusive criteria is pregnant women and lactating mother, type of Kushta like other. Patient with other systemic there is a criteria like a Kandu, Toka, Rukshata, and Toka Varna. Grade is grading is there, and there is objective parameters like Vrana Sankhya, timing of this duration of infection, its site of infection, and Vrana Aahara, etc. And as like that, we will do observational study for it. That's all. Thank you, guys.
Thank you, Dr. Pranit. Thank you for the presentation. Thank you so much, Doctor. Next is a poster presentation related to the Dushtavrana management. I would like to invite Dr. Ankita S. Tagare for the poster presentation. Dr. Ankita, are you there?
Yes, yes.
Good evening, Doctor.
Good evening. Let's start.
Please start, Doctor.
Good evening to the respected dignitaries, present all. Myself, Dr. Ankita Sudananda Thakre, PG final year student Shalya Tantra from Gramin Ayurved Mahavidyalaya, Patil. I am hereby presenting a poster. My topic is an Ayurvedic management of an infected wound, that is Dushtavrana with Charodaka Dhavana and Shatadhuta Group application of case study. Introduction. It is a discontinuity of skin and mucous membrane with molecular date of cells. Case report: 42-year female came with complaint of pain, edema, infected wound with foul smell, purulent discharge at right index finger with history of insect bite before 7 days. She has no history of any other major illness. Local examination: acidity was irregular, gandha, foul smell, varna, whitish yellow brown discoloration, Strava was purulent, Vedana was severe pain. Treatment given. Shodhan, that is cleaning, a thorough wash with normal saline followed by Charodaka Dhavan, which act as a disinfectant on wound. Shodhan helps to convert Dushtavrana into Shuddhavrana. And then Ropan, that is Shatadhata Bhuta dressing applied alternate day for 2 to 3 weeks, which lead to healthy and fast healing of wound. Result was pain was significantly reduced, swelling was no swelling there, discharge absent, and healthy granulation was achieved completely. Conclusion: Charodaka act as a disinfectant and Shatadhata growth significantly promotes the fast and healthy healing of wound. As per my study, we can definitely use this treatment for such cases in future. These are the pictures given before treatment, during treatment, and after application of Shatadhata Dhruta in second week. Thank you.
Thank you, Dr. Ankita. Thank you for the wonderful presentation. Next is a primary infertility management related paper presentation. I would like to invite Dr. Sumit Kumar Sunilrao Chandwadkar for the paper presentation on the topic Ayurveda management of primary infertility associated with endometriosis, a case report.
Hi, my name is Dr. Sumit Chandwadkar, and my topic is Ayurveda management of primary infertility associated with endometriosis. It is in a case report. Let's talk about abstract. This is a case report of a couple who presented with the primary infertility after 10 years of marriage. On clinical evaluation and investigation, the wife, age 32 years, was found to have endometriosis. She took various treatment including hormonal therapies and a multiple attempt of assisted reproductive technique of IUI and IVF. In Ayurvedic terminology, that case was diagnosed as one that were due to Vatiki Yonivapat associated with Paripluta. Internal medicines and Shodhan therapies, which includes Virechan, Basti, Uttar Basti, where the treatment modality is done, with the aim of providing Vata Shaman, Lekhan, Srodhan, and Garbhasthapan. Her 5 months of Ayurvedic intervention resulted in the conception, and she delivered a full-term female baby of 2.8 kg. Let's talk about an introduction of endometriosis. Endometriosis is a disorder in which tissue that normally lies the uterus grows outside the uterus. With endometriosis, the tissue can be found on the ovaries, fallopian tubes, or intestine. The prevalence of endometriosis is about 10%. The main focus of this case was primary infertility due to endometriosis. Infertility may be due to associated tubopathy or ovarian dysfunction. Common signs and symptoms include chronic pelvic pain, dysmenorrhea, painful intercourse, abnormal menstruation. A direct description of endometriosis in classical texts are not available. Due to some reason, the diagnosis and management of the condition is conducted based on the principle explained in classics. The associated symptoms like burning sensation, dyspareunia, etc. can be treated by adopting the management principle of Paripluta Yonivapat. Let's talk about patient information. Age of patient is 32 years, sex is female, visited in OPD with complaint of primary infertility since 10 years. And the semen parameters of the husband were found to be within normal limits. Menstrual history of a patient. The female patient had a regular menstrual cycle with an interval of 35 days and 4 to 5 days of duration. The right ovarian systemic examination was normal. They had undergone various modern infertility treatment methods, including artificial reproductive techniques of IVF, embryo transfer in past 9 years. Laparoscopy procedure will also be performed. Let's talk about clinical findings. The female patient was lean with a BMI of 23. No abnormalities were detected on general examination. The uterus was anteverted. Per speculum examination shows mild erosion in the cervix and moderate discharge, which has a physiological presentation. Common signs and symptoms: chronic pelvic pain, dysmenorrhea, painful intercourse, and mastalgia. Diagnostic assessment. The sign and symptoms of endometriosis and pelvic adhesion persisted at the time of consultation. Laparoscopic reports are the uterus was anteverted. The uterus is fixed posteriorly with both ovaries stretched behind and both tubes are tortuous in distal end. The bowel was adherent to the left uterosacral ligament. By analysis, the clinical feature investigation, the disease was diagnosed as Vandatva due to Vartiki Univapor associated with Pariplata. The predominant dosage was Vat and Pitta. Doshas was Vat and Pitta. Dushya, Rasa Rakta Mans, Srotas, Rasava Raktava Srota, Artava Srotas involved. Adhisthana was Garbhashaya. Status of Agni was found to be Manda. First internal therapeutic interventions. First internal medicine started, which medicines was continued for a period of 3 weeks. Considering the chronicity of the disease, Shodhan therapies were unavoidable. The modalities adopted were Virechan Basti, Uttar Basti as the main therapeutic procedures. Snehapan and Swedan as a preparatory procedures also be done. After completion of Shodhan therapies, internal medicines to be continued. Internal medicines, which include Panchamrut Vat, 15 ml with Anupan, 25 ml of lukewarm water, Chandrapavati, 1 tablet, morning and evening before food, Abhayarishtha, 25 ml morning and evening before food, after food. Properties and rationale of medicines use. Panchamrut Kwatha indicated in the second phase of Jara for the purpose of Amapachan, which has a predominance Tiktaras, Lagu, Ruksha, Ushna Virya, Katulpak was prescribed, which helped to maintain the Pitta, which was also one of the factors of idiopathy of the disease. After Shodhan therapies, let's talk about Shodhan therapies. Shodhan therapy includes Snehapan with Shatavaradikruta, Abhangas or and Svedang with Pindataila, Virechan with Avipatti Karchurna, Shirobasti with combination of Shatavaradikruth, Yashtimada Kalka, Goduchadik Shira Kashay, Maha Narayan Taila, Uttar Basti with Maha Narayan Taila. After the Shodhan therapies, we can continue the internal medicine Shatavaradikruth 5 ml in an empty stomach. Shirabala 10 drops with warm water in the evening were also given. During post-ovulatory period, Shatavaradikruth and Shirabala were administered for proper implantation. The menstrual cycle got delayed. The outcome was the menstrual cycle got delayed by 1 week. So UPT was suggested, which turned positive with LMP on 14/10/2027. On ultrasonography, presence of a single intrauterine gestation sac was observed. She delivered a female baby weighing of 2.8 kg. Assessment and follow-up. The complaints, which are dysmenorrhea, dyspareunia, mastalgia, after 4 months, complaints were decreased. Conclusion was, Ayurvedic treatment modalities can manage primary infertility associated with endometriosis. Even though it is a single case, the result observed in this case is encouraging, and the protocol following the case may be subjected to a clinical trial in a larger sample. And the scope for further study, basic understanding of Ayurvedic management in infertility, and more case studies will give a further direction to Ayurveda clinical trials in infertility. Further studies should focus on larger, more rigorous trials to confirm this finding and explore integrated fertility care. Thank you.
Thank you, Dr. Sumit Kumar. Thank you for the wonderful presentation. Next is a poster presentation of Dr. Sumit Kumar on the topic obstetric and oncology management of a patient diagnosed with breast cancer during the first trimester of pregnancy. A case report.
Hi, my name is Dr. Sumit Chanokar, and my topic for poster presentation is obstetric and oncology management of a patient diagnosed with a breast cancer during the first trimester of pregnancy. Then a case report. Case: a 33-year-old patient in her 8th week of pregnancy who is diagnosed with poorly differentiated ductal infiltration adenocarcinoma, presence of an intramammary positive lymph node, positive estrogen receptor, positive progesterone receptor, clinical detection of a breast mass during first operating appointment in the 8th week of gestation of the first trimester, which is later classified as a BIR-ADL4. Surgical management is performed with the modified radical mastectomy and sentinel lymph node with technetium-99 in 13th week of pregnancy. Chemotherapy is initiated at week 19 of gestation with doxorubicin 100 mg and cyclophosphamide 1000 mg. Caesarean delivery is performed at the week of 37, obtaining a female neonate of 2.6 kg and Apgar 9 at 5 minutes. Breastfeeding is avoided through pure WIM and paclitator is initiated at 120 mg per day. Discussion: breast cancer is the second most common malignancy diagnosed in pregnancy, going from 1 of 1000 to 1 of 3000 pregnancy. Only 3% of breast cancer cases are diagnosed in pregnant women with a mean age of 33 years old. Breast cancer in pregnant women is usually diagnosed in advanced stage and has a worse prognosis than in the non-pregnant woman. Due to the multiple physiology changes the breast undergo through this period, the management strategies will be determined by 4 factors: the biology of the tumor, the tumorous state, the gestation, and the desire of the patient. The treatment must attest to the non-pregnant standard. The conclusion was, as fertile women nowadays delay pregnancy, situation in which cancer occurs during pregnancy become more common. Management of an obstetric patient with cancer is multidisciplinary and initial clinical evaluation is essential for the early detection of pathologies that could be endanger life. Follow-up of a pregnant patient with cancer must be close with special attention to the fetal well-being. Medical surgical management is the safe during gestation and should not be postponed for the clinical state of pregnancy. Thank you.
Thank you, doctor. Thank you for the wonderful paper and poster presentation. Next, I would like to invite Dr. Anjali Uttambai Parma for the paper presentation. Dr. Anjali, are you there? Dr. Anjali, are you there? Dr. Anjali Uttambai Parmar, are you there? Okay, next we go to the next presentation. I would like to invite Dr. Rajnandini Janardhan Kamble for the paper presentation on the topic study of efficacy of Shatyadi Churna in the management of Pradishaya with respect to rhinitis.
Good evening, everyone. Myself, Dr. Rajnandini Janardhan Kadam, PG Scholar, Kamavritya Department. My guide are Dr. Mahesh Savule, sir, MD Kamavritya, Professor, Department of Kamavritya. I'm from Honorable Shri Annasaheb Dange Ayurved Medical College, Ashta, Sangli. Paper presentation title is Study of Efficacy of Shatyadi Churna in the Management of Pratishaya with special reference to rhinitis. Abstract. Pratishaya is one among Nasagat Roga, that is disorder of the nasal cavity. In present era of industrialization and modernization, There are some diseases which need to be given attention. Pratishyaya is one of them, as a respiratory system disease in which continuous contact with the external environment since birth and considered as a prime site of the hypersensitization. Ayurveda describes Pratishyaya as a Vat Kapha Roga. Symptoms of Pratishyaya resemble those of the rhinitis like blocking of nose, sneezing, runny nose, itching of nose, etc. Children are more likely to develop Pratishyaya, which disturbs their daily activity and may hamper their growth and development. There is no use of the antibiotics in acute rhinitis. There is limited data regarding the safety of pheniramine maleate, cetirizine, phenylephrine like antihistaminic drugs in rhinitis. The chronic stage of Pratishyaya, that is Dushta Pratishyaya, there is need to find out the best and Ayurvedic intervention to prevent and cure the Pratishyaya. Improper milk intake and sleep disturbances can lead to Pratishyaya in breastfeeding babies. Introduction. Pratishyaya is among Nasagat Roga in which Kaphadi doshas are continuously eliminated through the nose. These vitiated doshas accumulate in the head and their further movement towards the nose causes Pratishyaya. Vatam prati adhimukam shao gamnam kafadinam yatrasa Pratishyaya. It's from the Madhukosh Madhavnidan. This is acute disease of Pranavaha Srotas, mainly Vat Kapha dominant disease. Many acharyas have elaborated described the disease Pratishyaya in various Ayurvedic texts like Charak Samhita, Sushrut Samhita, Ashtang Hriday. Characteristic features of the Pratishyaya is Nasasrava, that is running nose, Nasa Avrudha, that is nasal obstruction or congestion, Shavatu, that is sneezing, Shirogaurav, that is headache, Kasa means cough, Aruchi means anorexia, Nasakandu, that is nasal itching. If Pratishyaya is being left untreated, it has enough potential to develop many conditions called Dushta Pratishyaya, with symptoms like Kas means cough, Shwasa, dyspnea, Ghananasha means anosmia, Badhirya, deafness, and last one is the Rajakshma, that is the form of this disease with the multi-system involvement. In modern science, it can be compared with the respiratory tract infection, that is rhinitis, in which nasal mucosa is inflamed due to infection, allergy, or injury due to direct contact with the external environment, exposes to many microorganisms, allergens, and pollutants present in atmosphere. Also, busy and change in lifestyle, rhinitis has become a common disease in present era. If no treatment is given early, it may get complicated and lead to other comorbid conditions like chronic rhinitis, cough, breathing difficulty with debility like Dushta Pratishyaya. There is no connection between the immunization and routine infection like rhinitis. Vaccination provides immunity against specific diseases, not against routine infections, which depends on the child's general immunity. There is limited data regarding the safety of pheniramine maleate, cetirizine, phenylephrine medicines like that is from the antihistaminic drug of modern medical system and describe number of therapy approaches, including corticosteroids, inhalers, etc. But none of them is totally effective in curing the illness and preventing its recurrence. Hence, there is a need to find out the best Ayurvedic intervention which can be used for prevention as well as cure for Pratishyaya for both adult and pediatric population. In Ayurveda, various treatment modalities of Pratishyaya explain according to avastha means stages. that is our apakva and pakva, and according to doshas, that is vata pitta kapha. Acharya Sushruta has elaborately described the treatment modalities of pratishaya in pakva and apakva avastha that indicate infective and non-infective pathology. Aim and objectives of my paper presentation. Aim to study the efficacy of Shatari Churna in the management of Pratishaya, and objective to study the effect of Shatari Churna in the management of Pratishaya. Methodology. In this study, the efficacy of Shatari Churna in the management of Pratishaya, Shatari Churna contains Shati, Bhumamliki, Shunthi, Pipali, Maricha with Anupana, Guda and Grita. षटी तामलकी व्यशचूर्ण सर्पी गुडान्वित हंति घोर प्रतिशाय पार्श्वशूल बस्तिशूल नूत योग रत्नाकर नासागर चिकित्सा, and also in the Vangsen Samhita Nasa Rogadikar Adhyay. Dosha karma of the ingredients. Shati have dosha karma like Vednasthapan, Deepan, Tamalaki have Kafapitta Shamak, Shunti, Kapavatagana, Pipli, Kapavatagana, Maricha, Shula Prashrama, Shira Virochanopak, Krimigna, Gudha, Bruhaniya, Gruta, Yogwahi. The dose of the churna is 3 gram BD. Child dose is according to age by 20 into adult dose. औषध सेवन काल at अधोभक्त काल Anupana, Guda and Gruta. In this Aushadhi Yoga, there is no Prakship Dravyas used. Therapeutic uses of the Shatari Churna. Shatari Churna is indicated for Pratishaya mentioned in Yoga Ratnakar Nasa Roga Chikitsa, used for Pratishaya, Parshvashula, Ridshula, Bastishula. Samprapti of the Pratishaya. In Samprapti, Pratishaya, there is Visheshan of the Vat Kafagna 3 dosh causes Visheshan of the doshas. It means 3 doshas. Then Strotorod forms and lodges in the head region, in which occurs Pratishaya. Conclusion. Shatari Churna mainly contain Shati Tamalaki, Shunti Pipali, Maricha. These drugs act as a Vednasthapan, Kapita Shama, Kapavatagana, Shula Prashaman, Shira Virachanopa, Krimigna, Bruhaniya. In Pratishaya, there is Visheshan of the Vat Kapa Pradhan Tridosha. They lead to Nasasrav, Kshavatu, Nasa Avrodha, Kasa, Shira Gaurav, Aruchi, Nasa Kandu. The Aushadhi Yoga Shatari Churna used as a Vednasthapan, Deepan, Kapapitta Shama, Kapavatagana, Shula Prashaman, Shira Virachanopa, Krimigna, Bruhaniya, etc. These all properties help to relieve the symptoms of the Pratishaya. The references are from the Ayurvedic management Pratishaya article like overview of Pratishaya and Ayurvedic management. Our books from the Charak Samhita, Sushrut Samhita, Ashtang Hridhay, and Vangasen Samhita, Madhav Kosh Nidhan, and also from the Kashyap Samhita, and books like Chikitsa, and some articles. Thank you.
Thank you, Dr. Rajandani. Thank you for the wonderful presentation. Next, I would like to invite Dr. Shatrughan Hanuman Netke for the paper presentation. Dr. Shatrughan Hanuman Netke, are you there? Dr. Shatrughan Hanuman Netke, are you there? Okay, next we go to the next presentation. Next, I would like to invite Dr. Arti Sriram Bajaj for the paper presentation. Dr. Arti, are you there? Dr. Arti Bajaj, are you there? Dr. Arti Sriram Bajaj, are you there? Dr. Arti, please unmute, doctor. Dr. Arti Bajaj, are you there? Dr. Arti Sriram Bajaj, are you there?
Yes, sir, I am there.
Good evening, doctor.
Good evening. Good evening, delegates. Am I audible, sir?
Yes, doctor, audible.
Myself, Dr. Arti Sriram Bajaj, PG scholar from Strirog and Prasuti Tantra from late Kedar Redekar Ayurved College, Gadhinglas. And I am going to present investigative protocols in gynecological cancer. Introduction. Cancer has become significant public health concern in India, and it is now one of the top 10 causes of death in the country. In India, about 50 to 60% of all malignancies in women are caused by three organs. They are cervix, uterus, and ovaries. Over 70% of women seek diagnostic and treatment services when their condition is advanced, resulting in low cervical and high fertility rates. The current cancer scenario for women in India definitely calls for awareness on prevention, early detection, diagnosis, better facility, treatment options, and follow-up at given time. Aim. Demonstrate ability to perform focused history, initial investigation to patient. Objective. To reduce mortality of gynecological cancer through the early detection of disease. And to spread awareness about cancer and its related investigations. First is the ultrasound. Ultrasound is invasive investigation in presence of pelvic mass. USG features of suggestive of malignancies, solid echogenic area, multicolority, thick and fronted septation, bilateralism, papillary protection, ascites, increased vascularity on the Doppler. Next, one of the type is transvaginal sonography, useful in women who are present with post-menopausal bleeding to decide whether endometrial sampling is needed or not. Next is assessment of level of CA125. CA125 is glycoprotein secreted by malignant epithelial tumor of ovary. Level of CA125 correlated with volume of tumor and is elevated in 50% of stage 1 tumor and 90% of tumors in stage 2. Next is exfoliative cytology. It includes pap smear, liquid-based cytology, and HPV DNA test. Pap smear is gold standard screening. The papillocoli test is method of cervical screening used to detect potentially precancerous and cancerous process in the transformation zone. The cells are examined under microscope to look for abnormalities. There are 3 types of spatulas for pap smear sample. And every woman above age 21 or 3 years after vaginal sex should be screened for pap smear. Liquid-based cytology, superior to pap smear, better sensitivity and speciality. The sample is collected in similar way to the pap smear. And head of spatula where cells are lodged is broken off into the glass vial containing preservative fluid. And then the fluid is taken for centrifuge. Then HPV DNA test. The test detects the presence of HPV virus that causes cervical cancer. Certain types of HPV includes type 16 and type 18, which increases the cervical cancer risk. Next is colposcopy and cervical biopsy. Abnormal cytology reports warrant the further evaluation with colposcopy and cervical biopsy. 3% acetic acid is applied on the cervix and biopsy is taken from the acetovyte areas. Diagnostic cone biopsy. If there is a mismatch between cytology and histology, if pap smear is abnormal but cervical biopsy is normal, then diagnostic cone biopsy is done. If entire TZ is not visualized on the colposcopy or unsatisfactory colposcopy, then diagnostic cone biopsy is used. If endocervical curettage is positive. Thank you.
Thank you, Dr. Ardi. Next, we go to the another paper presentation. I would like to invite Dr. Shubham Vishwas for the paper presentation on the topic Ayurvedic Management of Manohar Stress A Review article.
Hello,
Dr. Shubham, are you there?
good evening all.
Good evening, doctor. Your volume is very low, doctor.
Hello.
Hello, good evening, doctor.
Yeah, good evening. May I audible?
Yes, doctor, audible, doctor.
Should I start?
Please start the session, doctor.
During all classes, Dr. Shubham Vishwas, PhD scholar, Shelter Into Department, Mahatma Gandhi Ayurvedic College, Salil Varta, guided by Dr. Rajendra Associate Professor, MGSC, Varda. Today, my topic is an Ayurvedic management of Manohar Stress, that is stress, a review article. Introduction. Stress and depression is a common physiological disorder characterized by tiredness, loss of interest, loss of pleasure, feeling of guilt.
Myself, Dr. Shubham Biswas, PhD scholar, Department Shalya Tantra. Today, my presentation topic is Ayurvedic management of Manovasat, that is stress, review article. Now, introduction. Stress and depression is the common physiological disorder characterized by sadness, loss of interest, loss of pleasure, feeling of guilt or low personality, disturbed sleep, poor appetite, low energy, and poor concentration. It is a normal mood disorder in elderly and contributes to significant psychological and physical stress, physical disability, and mortality. Depression is mentioned in the Ayurveda classic in various scattered references. In Ayurveda, Vishada and Avasada are the two conditions which have close resemblance to depression. Now the definition of Manuvasad, concept of Avasad, the word comes from the basic Avasada and Dhvani. The symptoms of Avasad is sad, lazy, then sadness, sadama, dejection. Avasada literally means depression. The word Vishada has been mentioned with the text of Dosha Vikara. Charaka used the term sadhanam to refer the sense of depression and described as a Kafaja Unmada. There are various references as shown in the PPTs. Also, Vishad comprises a condition of a sada lassitude of speech, body, and mind. Now, why it's come? Nidan of Manovasada. There are ahara factors also, that is tamasic ahar included unhygienic food items, also kapha or improper dietary regimens. Also in Bihar, that is avam, rogaja, and then manasika karan, that like bhaya, irsha, dainya, lobha, chinta, etc. In samprapti, how it cause alpa sattva person get vitiated the doshas like raja, tama, vata, pitta, kapha, then manasa and sharira srotasa get affected. Localization of doshas in hridaya, then it causes manavasada. Samprapti ghataks are various such as agni, vishama and manda. Srotas, Manovaha Srotas. Also, there are Bhedas types such as Nija, Manovasada, and Manasika. Manovasada. Manasika includes Tamo Pradesh and Raja Pradesh. In management, there are different types of management. It means by taking resource, spiritual knowledge, patient courage, memory, and meditation. Also, Daiva Vipasha Chikitsa is also mentioned. Then Sattva Vajaya Chikitsa also have been mentioned. Yukti Vipasha Chikitsa is also mentioned. In medical treatment, Shodhana Chikitsa followed by Shamana Chikitsa is also mentioned. Followed by Snehapan, Virechan, Nasya Karma, Shirobasti. Also Shirodhara has been mentioned. Medicinal plants are mentioned such as Ashwagandha, Jatamansi, Kapipachu, Brahmi, Goduchi, etc. Now, finally, the discussion, the world is witnesses a world paradigm shift in the healthy care sector with a lenience towards the traditional system of drugs, and Ayurveda is lost of vigor. These guidelines of Patya Apatya Ahar includes the dominations of curative aspects. The concept of Sadvrita and Ahar Rasayan helps the preventing the derailment of the mind. The concept of Sattva Vajaya and Daiva Vashaya is used for the treatment, mobility and rehabilitation. All the types of goals, activities, attempts towards the straightening of the Sattva Baila, someone ideally aims to attaining the stage towards Sattva Vashaya Purusha in the positive psychological states. Thank you.
Thank you, Dr. Shubham Biswas. Thank you for the presentation. Next is the anatomical aspect of esophagus. Next, I would like to invite Dr. Sanjay Pargavkar for the paper presentation on the topic anatomy of esophagus.
Good evening, madam. My name is Dr. Sanket Kailas Pargavkar, third year PG, MD Rashmashari from JSU Osmanabad. My topic of presentation is anatomy of esophagus. The first point is introduction. It includes esophagus is a soft muscular tube that allows food to pass from pharynx to the stomach. It is collapsed at rest, flat in upper 2/3 and rounded in lower 1/3. It is a 25 centimeter in length, commences from the lower border of the cricoid cartilage, that is C6. Then it descends along the front of the spine to the posterior mediastinum, passes through the diaphragm and enters into the abdomen, terminates at the cardiac orifice of the stomach, opposite to the that is T12 vertebra. Next, in move on, upper limit is at the level of C4, C5, and lower at T9. Length at both 8 to 10 centimeter. End of first year, that is 12 centimeter. Fifth year, 16 centimeter. 15th year, 19 centimeter diameter. Whether follows the pool fluid passing through or not. At rest, it does 20 mm, but can stretch up to 20 mm. At birth, it is 5 mm, and at 5 years, it is 15 mm. Next one point is the embryology. A primitive forward forms at 4th week of gestation by longitudinal folding and incorporation of the dorsal part of the yolk sac into the embryo. There appears is a small diverticulum on the ventral wall of the foregut at the junction with the pharyngeal gut. Respiratory or tracheobronchial diverticulum. This tracheobronchial diverticulum separates from the developing esophagus by the formation of the esophageal septum. The developing esophagus is a short tube which extends from the tracheobronchial diverticulum to the future stomach. As esophagus lengthens, the heart and lungs descends accordingly. Upper third is striated and innervated by vagus, and lower third is smooth muscles and innervated by splenic plexus. Circular muscle coat is formed by the surrounding mesenchyma at 6th week. Longitudinal muscle coat forms at 10 to 15 weeks. At 7th week, lumen is filled with cells, but few vacuoles are present. At 10th week, lumen is completely restored. Blood vessels enter the esophageal wall at 7th month. Next point is the developmental anomalies, esophageal atresia or esophageal tracheoesophageal fistula. It is due to the spontaneous posterior deviation of esophageal tract septum, mechanical factor pushing dorsal wall of foregut anteriorly, and curvatures, there are anterior curvatures. It follows anteroposterior curve of vertebral column through neck, thorax, that is posterior mediastinum, and upper abdomen. The next point is the natural constriction. Cricopharynx C6 and distance from central incisor is 15 centimeter. I have taken vertebral level at T4. Distance from central incisor is 25 centimeter. Left main bronchus vertebral level at T5. Distance from central incisor is 28 centimeter. Esophageal hiatus is vertebral level at T10. Distance from central incisor is 14 centimeter. And these areas where most esophageal foreign bodies becomes entrapped. The most common site for esophageal impaction is at the thoracic inlet. The cricopharyngeus link at C6 is also at this level and may catch a foreign body. About 70% of blunt foreign bodies that lodge in the esophagus dwell at this location. Another 15% become lodged at the mid-esophagus in the region where the aortic arc and current develop, the esophagus on chest radiograph. The remaining 15% become lodged at the lower esophageal sphincter at the gastroesophageal junction, that is LES. Divisions include topographically there are the 3 distinct regions: cervical, thoracic, and abdominal. First is the cervical esophagus. It extends from the pharyngoesophageal junction to the suprasternal notch. It is about 4 to 6 centimeter long. The second one is thoracic esophagus, extends from the suprasternal notch to the diaphragmatic hiatus, passes posterior to the trachea, the tracheal bifurcation, and the left main stem bronchus. The esophagus lies posterior and to the right of the aortic arc at the T4 vertebral level. The esophagus lies anteriorly to the aorta from the level of T8 until the diaphragmatic hiatus. The third one is abdominal esophagus, extends from the diaphragmatic hiatus to the orifice of the cardia of the stomach. It forms a truncated cone about 1 centimeter long. Two high pressure zones prevent the backflow of food, the upper and the lower esophageal sphincter. The first one is the upper esophageal sphincter. It between the pharynx and the cervical esophagus, located at C5 and 6 level. The upper sphincter is a muscular cartilaginous in structure. This is formed by fibers of cricofaringeus part of the inferior constrictor, which encircles the esophageal entrance. The cricofaringeus muscle is a striatal muscle, produces maximum tension in the direction and less tension in lateral direction. A compound of a mixture of fast and slow switch fibers. This muscle forms the main component of upper esophageal tract. The second one is the lower esophageal sphincter. The lower esophageal sphincter is a high pressure zone located where the esophagus merges with the stomach. Mean pressure here is approximately 8 mmHg. The lower esophageal sphincter is functionally composed of an intrinsic and extrinsic component. The intrinsic is a esophageal muscle fibers and is under neurochromical influence. Extrinsic is the diaphragm muscle. The endoscopic localization of the lower esophageal sphincter is different from the monometric localization. The endoscopic localization is determined by changes in the esophageal mucosal transition from non-striated commissous esophageal epithelium to the gastric mucosa. The functional location of areas that is lower sphincter is 3 cm distal to the Z line. The next is the attachments of esophagus. The attachment of a cranial end of esophagus first point, and the longitudinal muscle attaches to the lamina of the cricoid cartilage by means of tendon. That is the cricoesophageal tendon. And attachment of tuberous esophagus is attached to trachea, pleura, and prevertebral fascia by several fibrous standards. The third attachments of distal end is to dichromatic crura and phrenoesophageal ligament. The phrenoesophageal ligament is created by blending of the subdichromatic fascia and the endothoracic fascia, also known as the limus fascia or Allison's membrane. The two sheets, upper inserts into esophageal tunica muscularis and submucosa, lower inserts into gastric serosa and mesentery. Next point is the relations of esophagus. First is cervical part. It is trachea anteriorly. Posteriorly vertebral fascia. Thoracic duct lies behind the left border. Thoracic part in superior mediastinum. Esophagus lies between trachea and vertebral column. It enters posterior mediastinum behind aortic arch at T4. Laterally, in the left, arc of aorta, vagus nerve, left subclavian artery, pleura, and in right part, esophagus vein and pleura. Third is abdominal esophagus. It lies slightly left to median plane. Related to the posterior surface of the left lobe of the liver, right border is continuous with lesser curvature and left ends in the cardiac notch and is covered by peritoneum anteriorly. Next point is a blood supply. Blood supply, the reach below arterial blood supply of the esophagus is segmental. Branches of the inferior thyroid artery, upper esophagus sphincter and cervical esophagus. Paired aortic esophageal arteries or terminal branches of bronchial arteries are supplied by thoracic esophagus. The left gastric artery and a branch of left phrenic artery is supplied by ileus and the most distal segment of the esophagus. Venous drainage is venous supply is also segmental. From the dense submucosal plexus, the venous blood drains into supravena cava, veins of proximal and distal esophagus, it drains into azygous system, veins of esophagus, it drains into collaterals of left gastric vein. Nerve supplies, parasympathetic nerve supplies is upper half recurrent laryngeal nerve, lower half is esophageal plexus formed by the two vagus plexus. The sympathetic nerve supply, upper one half is by fibers from mid cervical ganglion, lower half directly from upper from thoracic ganglia. So this is my topic of this anatomy of esophagus. Thank you very much.
Thank you, Dr. Sangat. Thank you for the wonderful presentation related to the esophagus. Next, I would like to invite Dr. Mayur Rajendra Medkar for the paper presentation on the topic, a randomized controlled clinical study on the efficacy of Chitragrindhakadi syrup in the management of malabiband with respect to constipation in preschool children.
Good morning, sir. Good morning, ma'am.
Myself, Dr. Rajendra Medkar. I am a PG scholar, third year student, Department of Ayurvedic. I am here to represent my paper on a randomized controlled clinical study on the efficacy of Granthikadi syrup in the management of Malvibandha with special reference to constipation in preschool children. As an introduction, we can see Malvibandha is not a disease, it's a symptom, but this symptom has become a major issue in today's life. According to Ayurvedic Shabdakosh, Vibandha meaning apravritti. Hence, Malvibandha can be described as Mala is equal to apravritti. So, Malvibandha can be correlated with constipation with its clinical manifestation. Constipation is defined as delay or difficulty in defecation due to hardened feces present for 2 or more weeks and sufficient to cause significant distress to the patient. It is commonly seen in preschool children, and a recent systemic review found that the median prevalence of constipation in children was 12%. Vibandha is very common in children due to altered food habits, raised fast food culture, improper diets, improper toilet training, changing sleep pattern, and also disturbed routine of working mothers, which leads to improper method of feeding, lack of exercise, and impact of very stressful childhood. Example, joining of school. Malvibandha is described in many Ayurvedic Samhitas like Madhav Nidan, Sushrut, Charak, etc. In this Anuloma Gati of Apan is obstructed and arm becomes Pratilom, so Purisha is obstructed in Pakwashaya, and further complications such as unsatisfactory bowel emptying, indigestion of food, etc. occur, which leads to deterioration of health of child. Need of strength. Constipation is commonly increasing in childhood. It may generate indigestion, irritability, emotional disturbances, and also impacts on family of patient. In modern medicines, management of constipation is mainly laxative. The most common and important side effect of laxative is dependency. Also disturbs the good flora of intestine. But in comparison, there are very few formulations nowadays using for Malvibandha by current practitioners, where our Ayurvedic Samhitas have given us a bulk of knowledge in which many good formulations are there on Malvibandha, which are yet to be tested. One of those is Chitragranthagadi syrup. Contests are as follows. Chitrak and Pipli wool have Agnidipak and Sansrinya properties. Erand have Virechan. The drug also breaks obstruction, either constipated or loose fecal matter, and expels out. Shunti have Agnidipak and Anuloma property. Hindu does Ampachan and hence reduces harm. Wheat Lavan and Sendav Lavan have Agnidipak, Anuloma, and Vibandhagana properties, while Buddha act as Koshtashodha, which helps to cure Malvibandha. Research question. Is Chitrakantikadi syrup as effective as Shuntadi syrup in the management of Malvibandha in the age group 3 to 6 years? Hypothesis. First, null hypothesis. Chitrakantikadi syrup is not as effective as Shuntadi syrup in the management of Malvibandha. Alternative hypothesis. Chitrakantikadi syrup is as effective as Shuntadi syrup in the management of Malvibandha. Literature from Ayurvedic Samhita. The review of literature includes a thorough screening of Ayurvedic texts, contemporary Ayurvedic literature, and modern texts. Some of the texts are as follows. Nidana, Samprapti, and Lakshanas of Malvibandha are explained in Charak Samhita, Sushrun Samhita, Ashtanghride, Ayurvedic Shabdakosh, Chitrakantakadi Kashai, syrup explained in Sahasrayuga. Drug reference. Chitra Granthik Erender, Shunti Vatha Paramhitam, Sulana Vibandeshu, Sahishu Veda Saindava. Reference is mentioned in Sahasrayugam by Dr. Sharma, Chokamba Sanskrit Pratishthan, 2019 edition. Kashaya Prakaran, Malashodhan, Kashaya, page number 36. Aim and objective. To study efficacy of Chitrakrantikadi syrup and Shuntadi syrup in the management of Malvibandha. Primary objective. To assess the efficacy of Chitrakrantikadi syrup in the management of Malvibandha. To assess the efficacy of Shuntadi syrup in the management of Malvibandha. Secondary objective. Compare the efficacy of Chitragranthikadi syrup and Shuntadi syrup in the management of Malvibandha. Methodology. We have done screening in which we have performing inclusion criteria satisfied and exclusion criteria excluded. We have taken an informed consent. Then simple lottery selection of 30 children of each group will be selected irrespective of gender. Then group A and group B divided in 2 drugs, in which group A considering Chitragranthikadi syrup and group B will be considered with Shuntadi syrup. Initial assessment with the help of case record form, then after comparison both the drugs, then there is final assessment and conclusion as per statistical analysis. Sample size and its calculation. 60 patient diagnosed as Malviruddha will be selected for study. This 60 patient will be randomized and grouped in two groups of 30 patients. We have mentioned citations so that we can get the sample size and its calculation as mentioned. Sampling method is nothing but simple random sampling method. Method of selection of study subject. Inclusion criteria. Subject of preschool age group will be selected irrespective of gender, caste, and religion with following criteria. Children fulfilling room 3 criteria must include at least 2 of the following symptoms. That is, 2 or few defecation in the toilet per week, at least 1 episode of fecal incontinence per week, history of painful hard bowel movements, presence of large fecal mass in the colon, history of large diameter stool which may obstruct in the toilet, abdominal pain, and anorexia. Exclusion criteria. Exclusion criteria consider known case of irritable bowel syndrome, known case of hormonal disease as hypothyroidism, known case of other systemic illness like TB, HIV, known case of disorders as Hirschsprung disease, known case of any neuromuscular disease like cerebral palsy, suspected patients of COVID-19, below 3-year and above 6-year patients will be excluded. Operational definition. Operational definition is nothing but Malavibandha. It is described as Malapravriti. Constipation is defined as delay or difficulty in defecation due to hardened feces present for 2 or more weeks or sufficient to cause significant distress to the patient. Kashaya refers to a water decoction or water extract of a single herb or group of herbs. Wilcoxon sign rank test to check efficacy of treat A and treat B. Man Whitney test to compare efficacy of treat A and treat B. Specification of instruments and related measurement. Diagnostic criteria. Pre-assessment screening of constipation in children will be done according to Rome 3 criteria. Assessment criteria, which is in subjective criteria. So we can consider frequency of bowel, and we have given the grades and frequency, which is 0, 1, 2, 3, and frequency as 0 for 0, 1 to 2 times per 1 to 2 day. For grade 1, 2 times per week. For grade 2, 1 time per week. For grade 3, less than 1 time per week. Consistency of feces, we have also given grade and symptoms as shown. Then painful defecation, we also given grade and then symptoms as shown. Then objective criteria, abdominal distension, which is present or absent. And abdominal pain, we have also given grades and symptoms. Group of patients. Group A, Chitra Granthikadi syrup used in 30 patients. And Group B, Suntaji syrup used in 30 patients. Withdrawal and fulfillment criteria. If some patients withdraw the treatment, meanwhile, then required patients again selected on the basis of all criteria mentioned above. Dose. As per Clark's formula, weight in kg divided by 60 into adult dose. Chitra Granthikadi syrup and Suntaji syrup per body weight 0.66 per ml per kg per dose at Apanakala will be given to children. Duration 7 days. Follow-ups will be taken on 3rd and 7th day with the window period plus 5 days. Then again follow up after 15 days to see recurrence. Safety of drugs. All drugs are safe for human trials according to textbook of Indian Materia Medica. Adverse drug reaction. Patient will be instructed to report adverse drug reaction if any. So as soon as observed, and they will be given suitable treatment. Study instrument or data collection tools, case record form. Assessment of clinical result as shown completely improved, which is 100% relief in the subjective and objective parameters and no relapse in the follow-up study. Markedly improved, which is mentioned further, then moderately improved, mild improvement, and no improvement. Thank you.
Thank you, Dr. Mayur Rajendra Medkar. Thank you for the wonderful presentation. Next, I would like to invite Dr. Shatrughan Hanuman Netke for the paper presentation on the topic a case study on Anantavada with special reference to trigeminal neuralgia.
Everyone, my name is Dr. Shatrughan Netke, PG scholar, Sharirasana Department, GSC Dharashaw. My guide name is Dr. Manisha Dowry, Head of HOD, Sharirasana Department, GSC Dharashaw. I would like to case presentation. My topic name is a case study of Anantavad with special reference to trigeminal neuralgia. Trigeminal neuralgia is a sudden, usually unilateral, severe, stabbing, recurrent episode of pain in the distribution of one or more branches of trigeminal nerve. Etiology of trigeminal nerve. There are two types of etiology like intracranial causes, extracranial causes. Intracranial causes like multiple sclerosis, demyelination of the nerve, intracranial tumor at the cerebro-pointy angle, intracranial vascular abnormalities like basilar artery aneurysm. Extracranial causes like vascular factor, dental etiology, post-traumatic neuralgia, infection, and viral etiology. Types of trigeminal neuralgia like pre-trigeminal neuralgia, idiopathic trigeminal neuralgia, typical or atypical trigeminal neuralgia, secondary or tumor-related trigeminal neuralgia. Clinical feature of trigeminal neuralgia like shooting pain that may feel like an electric pain in area supplied by the trigeminal nerve, including the cheeks, jaw, teeth, gums, lips, or less often the eye and forehead. Pain affecting one side of the face at a time may be rarely affect both sides of the face. Pain focus in one spot or spread in wider pattern. Attacks that become more frequent and intensive over time. Stroke of Anantavad, Susrut Uttarasan 25. दोषास्तो दुष्टास्त्र यो मन्यम संपीडे घाटस्थो रुजम सुतीव्रम कुर्यन्ति साक्षिभ्रुवं शंखद्वेषे स्थितिं करोत्यस्तु विशेषस्तु गण्डस्य पार्श्वे तु करोति कंपः अनुग्रह लोचना च रोगनम् अनंतवात तमुदाहरन्ति दोषत्रयोत शीर्ष विकारम अनंतवातो कर्तव्य सूर्यातरो विधि शिरावेदस्य कर्तव्य अनंतवात प्रशांतये आहारस्य विधातयो वात पित्त विनाशनम मधुमस्तक संयाओ कृतपुरेश्च भोजनम. Patient age is 41 years, female patient, occupation housewife, weight 28 kg. Patient is given Shala Ketantra Department of GSC Dharashaw. Patient complaint, sharp pain at the right temporal region radiating to right side of forehead more as compared to the right cheek, swelling around the right eyes, spasm of the temporomandibular joint, unable to chew from right side, tongue deviates towards the right side and gets compressed between the right side, tooth in the upper and lower quadrant, resulting in bleeding and thus developing of wound since 2 years. History of present illness. In June 2023, patient is consulted neurophysician at Solapur, was diagnosed with trigeminal neuralgia. She was started with TAP Tegretol 100 mg 1 BD, TAP Leofen 5 mg 1 BD, and injection Botox was given. The intensity of pain and spasm reduced, but used to feel drowsy the entire day, due to which her daily activity was affected. In May 2024, she came to GSC Dharashaw with the above mentioned complaints for further intervention. Past history. Hypothyroidism since 4 years. Drug history like tablets Thyronorm 50 mg 1 BD, tablet Tegretol 100 mg 1 BD, and tablet Leofen 5 mg 1 BD. Samprapti. Hetu Chintayam च अतिचिंतायाथ causes arasava स्रोत दुष्टि त्रिदोष प्रकोप संसर्जन of the tridosh in the sera of the shears, exhaustive pulsation of blood vessels, atipravurta upon the trigeminal nerve root, obstruction sanga to the delivery of signal to the nerve nucleus. This causes hyperactivity in the trigeminal nerve root, lead to severe pain in the Akshi, Dhruva, Shankha Pradesh, spasmodic contraction the facial muscle, Netrarogam, Anugraham, thus producing Anantwad. On examination, general examination, systemic examination is normal. Internal medicine, first 15 days medicine given Vidaradi Kashay 15 ml BD Leucom water, Lakshmi Vilas Ras 125 mg 1 BD water, Kshirvala 101 is 5 drops OD with milk. Next 30 days medication. Vidaradi Kashay 50 ml BD Leucom water, Kshirvala 101 5 drops OD milk with milk. Kalyana Grutam 5 ml EHS Leucom water. Panchkarma procedure for first 10 days. Shirodhara, Chandal Malada Lakshadi Tel, 500 ml. Gandush, Irimidadi Tel, Lavang Tel, Estimadu Quad, 5 ml each Tel, 100 ml quad. A gap of 15 days. After next 10 days, Nasyam, Vacha Telam for 3 days, Kshirvala Tel for 7 days. 4 drop in is not sweet. Shirodhara, Chandan Vala Lakshadi Tel, 500 ml. Clinical features. Pain in the right temporal region. Before treatment, treatment is mentioned with the grade wise. So pain in the temporal region like before treatment 4, after treatment 15 days, 30 days, 45 days. 15 days 3, 13 days 2 and 45 days 1. Relief is 90%. Then spasm of the temporomandibular joint. This is result given by in grade wise. Before treatment 3, after treatment 50 days, 30 days, 45 days. 50 days 2, 35 days 1 and 45 days 0. So relief is 100%. Discussion. In this study, Shirodhara Rishek, which is one among in Chaturved Mordha Tailam was done. It is therapy indicated in Shira Todam, Chandan Bala Lakshadi Tailam having Pitta Kapahar and Balya property was used. Nasya is one of the effective Panchkarma indicated in Urdhva Jatru Vikar. Virechan Nasya with Vacha Tailam was given for 3 days. Eliminate Kapadosh followed by Brahman Nasya with Kshirvala Tel for 7 days to eliminate Vata and Pitta dosh. Gandush is therapy indicated in Manya, Shiro, Mukha and Akshiro was given. A combination of Shigna and Ropan Gandush was given with Irimedadi Tel, Lavang Tel, Estimaduquat to reduce the pain and also heal the ulcer of the tongue. Vidaradi Kasham was given for intake due to its Vata, Pitta and Brahan property. It also helps in reducing Angashul. Shervala 101 was given 5 drops with milk for intake due to its Rakta Prasadak and Vata Pitta property. It is also helps to straightening the nerve. Conclusion. This treatment is very effective and came to result very fast. Thank you.
Thank you, Dr. Shatruhan Hanuman Netke, for the wonderful presentation. Next, I would like to invite Dr. Mandagini Eknath Togal for the paper presentation. Dr. Mandagini, are you there? Dr. Mandagini Eknath Togal, are you there? Dr. Mandagini, are you there? Next, I would like to invite Dr. Rajashri Gadekar for the poster presentation. Dr. Rajashri Gadekar, are you there? Dr. Rajashri Gadekar, are you there? Next, I'd like to invite Dr. Marodi Tugaram Malge for the poster presentation. Dr. Marodi Tugaram Malge, are you there? Dr. Marodi, are you there? Next is a paper presentation. I would like to invite Dr. Kamini Dattatreya Suresh for the paper presentation. Dr. Kamini Dattatreya Suresh, are you there? Dr. Kamini Suresh.
Yes, sir. Yes, sir.
Good evening, doctor.
Good evening, sir.
Good evening, sir.
The screen is visible, doctor. Please check the session.
Yes, sir. Screen is visible now, sir.
Yes, doctor, visible.
Good evening to all. I am Dr. Kamini Surushe from Late Kerari Redekar Ayurvedic Mahavidyalay, Gadinglas. I am representing the topic randomized control clinical trial to evaluate efficacy of Ayurveda Siddha Tela Pichu in management of Parikartika with special reference to fishery nano. Introduction. In the today's era of Western lifestyle, IT professional, and of course of the outbreak of COVID-19 pandemic leading to the sedentary work from home, lack of exercise, unhealthy eating habits, regularity in diet. In addition to this, one is always under tremendous stress and causing disturbance in digestive system along with the anorectal pathology. Parikartika is one of them. पित्तं गत्वा गुदं समाशु दोष आमं निरस्यश्च तीव्रशूलसपिच्छास्रावं करोति परिकर्तिका. Parikartika is characterized by Tivrashula, Daha, Vibandha, Sapichastrav, Ruja, and Aruji. Similarly, fishery nano is characterized with the severe pain before and after defecation, burning sensation, severe constipation, and harsh stool, and blood drops or streak of fresh blood along with stools. Longitudinal epithelial split because of their location involving the exquisitely sensitive anodome in lower and anal canal leads to fishery nano. The pain is severe that patient develops fear for defecation. This condition causes the distress and daily routine is hampered drastically and hence the condition must be taken under consideration. In male, fissure usually occur in midline, posteriorly 90% and much less commonly anterior 10%. In case of female, it occurs midline posteriorly are slightly common than anteriorly in the ratio of 60:40. Anterior anal fissure is much more common in women and may arise following vaginal delivery. Need of the study. Nowadays, there is a large number of people affected with anorectal diseases like fishery nano. At present, the prevalence rate of this disease is 10%. Also, it is estimated to be increased over large scale in the coming era due to changing lifestyle. According to modern science, anal fissure are treated by lateral sphincterectomy, posterior fissurectomy, loss dilatation, etc., which has complications such as fecal incontinence, repeated episodes in future, and increased cost of the treatment. Ayurveda being the ancient science, as mentioned, Picha Basti, Anuvasan Basti, Parishek, Pichu, and local administration of Sneha Dravya, which relieve Vata and Pitta in the management of Parikartika. Pichu is being the most easy to use, effective, and less time consuming. Aravgata Kshar Siddha Tel Pichu has been chosen for my research study. This concept has taken from Shushru Samhita, where he mentioned that Kshara Siddha Tela can be used for Vrana Shodhana. So, considering fissure ulcer as a Dushta here are some references. दुष्टव्रणेषु कर्तव्यम् ऊर्ध्वं च अधशोधनं विशर्षनाश तथा आहारं शोणितश्च मोक्ष कषाय राजवृक्षादौ सरसादौ च धावना कषायेन तैलशोधं मिष्यन्ति क्षारकल्पना व तैल क्षारद्रव्येषु साधितम्. These are some references for Parikartika. Objectives of study. Primary objective to assess the efficacy of Aragva Kshar Siddha Tel Pichu in healing of Parikartika. Secondary objective to compare efficacy of Aragva Kshar Siddha Tel Pichu with spear ointment in healing of Parikartika. To study Parikartika in detail according to Ayurveda as well as modern science. To study modern literature available in Fishery Nano. To study pathophysiology of Fishery Nano. Methodology used. This is a randomized controlled clinical trial. 60 randomized selected patients of Parikartika will be divided into two groups, mainly trial group A and control group B. Each group allotted into 30 patients. Informed written consent will be taken of each patient prior to research. Authentication and standardization of trial drug Aragva Kshar Siddha Tel will be done at appropriate laboratory. The control drug spear ointment will be purchased from the GMP certified company. The trial group patient will locally apply Aragva Kshar Siddha Tel Pichu on fisher bed twice a day for up to 15 days, and the control group patient will locally apply spear ointment on a fisher bed twice a day for up to 15 days. All the observed changes will be recorded special cases. Paper format designed for the study. Follow will be considered on 1st, 5th, 10th, and 15th day. From observation, discussion and conclusion is drawn. Drug review. Dravya, Aragvad, Kshar, and Tel. Latin name Cassia fistula. Family Leguminosae. Rasa, Madhur. Virya, Shita. Vipak, Madhur. Guna, Guru, Mrudu, Snigdha. Doshagnata, Kafavata, Pittagna. Prayojanga, Patra, Tvaka, Pushpa, Falamajja. Karma, Vranashodhana, Ropana, Kandugna, and Kushtagna. These are some properties which are using in the study. Trial group A. Aragva Siddha Tel. Aragva Shar Siddha Tel Pichu is advocated here for the management of Parikartika as an external application of Siddha Tel Pichu. These are some references from it is taken. Aragvad is one of the Shodhan Dravya. In Aragvadadi Gana told by Shashrata for Vrana Shodhana, Aragvada can be used in preparing shar as told by Shushruta. He has also explained Sharatel can be prepared and used for Vranashodhana. This drug Aragvada is Vranashodak, Vranaropak, Kandugna, Shulagna, and shar is having a property of the Hana, Pachana, Dharana, Vilayana, Shodhana, Ropana, Stambhana, Lekhana. So this combination of Aragvada Kshar has been selected in the form of Siddha Tel Pichu in healing of Parikartika by considering the Parikartika as a Dushtovran. Control group spear ointment. It contains polycerulin 50 mg and cinchocaine hydrochloride 10 mg. This is a skin ointment that has anesthetic and pain numbing properties used to relieve pain, discomfort, itching associated with fissure in ano and hemorrhoids. Criteria for assessment. Inclusive criteria for patient with acute fissure in ano, patient of age group 16 to 60 years suffering from only fissure in ano. The case will be randomly selected irrespective of sex, chronicity of prakriti, doshas, and type of fissure. Exclusive criteria: fissure secondary to fistula in ano, ulcerative colitis, tuberculosis, syphilis, Crohn's disease, other systemic disease permeating to colon, colorectum, known suspected case of malignancy, carcinoma of rectum and anus. Patients suffering from infectious disease like HIV, STDs, etc. Patient with other systemic disorder like hypertension, uncontrolled diabetes mellitus. Withdrawal criteria. During course of trial treatment, if any serious condition or any adverse event which requires urgent treatment, if patient themselves wish to withdraw from the study, such subject will be withdrawn from the trial. Patient which fails to report for follow or regular medication will withdrawn. Subjective assessment. Gudagat Shula, assessment of pain gradation before and after treatment, VAS scale and verbal scale, VDS scale. Gudagat Raktastrav, Gross bleeding, assessment and gradation of per rectal bleeding will be based on self-assessment score. Gudadaha burning. These are some gradation. Grade 0, no pain, no burning sensation, no bleeding. Grade 1, 15 to 20 minutes pain before and after defecation. 15 to 20 minutes burning sensation before and after defecation, and occasional wetting of undergarments in slight bleeding. Grade 2, 30 to 60 minute pain before and after defecation, 30 to 60 minute burning sensation before and after defecation, wetting of undergarment, moderate bleeding. Grade 3, continuous pain, continuous burning sensation, heavy bleeding which requires pads. Objective assessment, two criteria, tenderness and sphincteric spasm. Grade 0, no tenderness, no sphincteric spasm. Grade 1, mild tenderness, allowed to PR stage, mild pain. Grade 2, moderate tenderness, allowed to PR with moderate pain. Grade 3, severe tenderness, not allowed to PR examination. Overall assessment, observational assessment criteria. Observations of both group A and group B will be compared before and after treatment. Symptom scoring grade pattern. Improvement, relief and grade. Marked improvement, relief more than 75%, it comes under grade 1, score is 13 to 16. Remarkable improved, relief in between 50 to 75%, grade 2, 9 to 12 score. Improved, relief in between 25 to 50%, 5 to 8 score, grade 3. Unchanged, relief less than 25%, 1 to 4 score, grade 4. Statistical analysis. Statistical analysis will be done on the basis of collected data and statistical method. Suitable test will be applied as per discussion with statistician. Inference. Result and inference will be drawn on the basis of reading obtained before and after treatment by using statistical method. Discussion will be made after statistical analysis and according to the result observed at the end of treatment. Conclusion. Final conclusion will be drawn on the basis of statistical analysis. Overall assessment. Summary. All the clinical study will be summarized step by step. Thank you, sir.
Thank you, doctor. Thank you for the wonderful presentation. Thank you so much, doctor.
Thank you, sir.
Next is a case study presentation. Next, I would like to invite Dr. Poonam Tagare for the paper presentation on the topic role of Garbhashayagata Uttarabasti in female infertility due to tubal blockage, a case study.
Savi, I am angry on you.
Good evening, everyone. Myself, Dr. Poonam Dharma Thakre, PG Scholar, second year, Srirog Evam Prasuti Tantra Department, Government Ayurvedic College, Dharashu. My topic name is Role of Garbhashayagata Uttarabasti in Female Infertility due to Tubal Blockage, a case study, under the guidance of Dr. Umesh Agaune, Associate Professor at Government Ayurvedic College, Dharashu. Introduction. Infertility is defined as inability of a couple to conceive after 1 year of regular unprotected sexual intercourse. ध्रुवम चतुर्ना सानिध्यात गर्भस्याद विधिपूर्वक ऋतुक्षेत्रंबु बीजांना सामग्य अंकुरो येता. Among the important factors for conception, Acharya Sushruta has included Rutukal, healthy body is a stable mental status, Ambu, Bija, for a healthy sperm and ovum. स्त्री वंदित्व हेतु ऋतु अंबु क्षेत्र बीज दुष्टि आत्म जाति षडभाव दुष्टि आहार दोष विहार दोष अकाल योग सेवन बलक्षय अन्य व्याधि परिणाम स्वरूप. Causes of female infertility are uterine factors are 10%, pelvic factors, ovarian factors, cervical factor and tubal factors. Pathogenesis of tubal blockage according to Ayurveda. Kapha and Vata Prakop Ahara and Vihar. Ahar includes Snigdha Abhishandi Shit Ahar. Vihar includes Divas of Veva. Accumulation of Kapha dosh in Arthava Srotas, that is tubal blockage. Sroto Arthavrod Janavat Prakop, no fertilization. Vanditva tubal blockage induce infertility. Aims and objective to study the infertility case, to study the tubal blockage and induce female infertility, to evaluate the efficacy of Garbhashayagata Uttarabasti in tubal blockage, induce female infertility. Material and method. Case study: CHIP complaint, a female of 22 years come to Sirog and Prasuti Tantra OPD with primary infertility and anxious for conception. Her menstrual history is LMP 5 January 2023. Menstrual flow for 3 to 4 days, cycles regular, 28 to 30 days duration, moderate flow with mild pain. History of present illness after active married of 3 years. Her HSC report was suggestive of right side corneal block. Treated by different treatment modalities, but with the failure, she finally came to OPD of Srirog and Prasuti Tantra department at Government Ayurvedic College, Dharashu. Her personal history is occupation wise, she is a housewife, appetite good, sleep disturbed sometimes, bowel constipated sometimes, bladder clear, psychological status stress and anxious, husband occupation worker, addiction no any. On examination, vitals are normal. Her weight is 65 kg. As you can see, her SSG report and USG abdo-pelvis are mentioned there. Per abdomen soft, no any tenderness. On per speculum examination, healthy cervix, no any abnormal discharge. On PV examination, uterus antiverted, antiflex, cervical motion tenderness absent, no tenderness at vaginal fornices. Investigation done for both partners, female and male partner. Her routine checkup like CBC, BSL done. Ovulation study also suggestive normal. Her HSG report done on 8 January 2022, which shows a complete non-opacification of right fallopian tube noted, representing right corneal block. Male partner semen analysis done, which was absolutely normal. So it was observed that female partner was having right corneal block, and her other reports are normal. So line of treatment here is Sanshothan Karma, that is purification therapy. After analysis of the Sroto Sangha, that is Kshetra Drushti is observed here. So treatment done for from March 2023 to August 2023. Sanshothan Karma includes 3 cycles of Yog Basti. Their Anvasan Basti with Sarcharadi Tel 60 ml and Nirva Basti with Eranda Muladi Kashay 450 ml, and 3 cycles of Uttar Basti with Balatel 3 ml and Shartril 3 ml done. For Sanshaman Karma, Rasapachak Vati 2 BD, Lashunadi Vati 2 BD, Maharasnadi got 25 ml, and Lata Karanjvati. As Yogbasti is Vatagna, Srota Shodak, Balavradhak, and Mala Sangrahi Karma done. Uttar Basti as a Shartel is suggestive for Srota Shodha due to the Ushna Tikshna properties, help to remove the fibrosis, and Balatil is a Balya Bruhaniya, thus helps in nourishment of the reproductive organ and baby lighter, helps in proper development of endometrium and follicles, result in healthy progeny. And other oral medication include Rasapachak-Vati, Lashunadi-Vati, Maharasnadi-Kwat, and Lata Karanjvati, which is Deepan Pachan Vatagna, indicated in infertility. Observation and result: after 5 months of regular treatment, after 3 settings of Uttar Basti for 3 consecutive cycles, along with Shaman Aushti, patient missed her period. UPT was positive on 5 September 2023. LMP is 21 July 2023, and her EDD is 26 April 2024. USG ops done on 5 9 2023. A single intrauterine gestation cycle is noted, corresponds to 5 weeks and 5 days. Patient regular came for ANC checkup. Patient delivered FCH. Patient delivered FCH of 2.8 kg on 17 April 2024. So conclusion, it seems what dominant tridosh Vadi, where kapha can be another dominant dosh, hence local instillation by intrauterine Uttar Basti of Vat Kapha Shamak and Tridoshagna drugs with Sushma Sar Katu Ushna and Tramathi property, which can be helpful to remove the blockage and to restore the tubal function. Discussion: becoming mother is the most dream of all women. Ritu, Kshetra, Ambu, and Beach are the four essential factors for fertility. Defect in any of these result in Vandhatva. In the present case report, it was considered as case of Vandhatva due to the Kshetra Dushti, that is stipple blockage, as the main cause. Obstruction in the Artava Srotas is due to the Kapha dosh and Vat dosh. For clearance of this Srota Rod, Shodhan Karma in the form of Yog Basti and Garbhashya Gata Uttar Basti was planned. Thank you.
Thank you, Dr. Poonam Tagare, for the well-explained case presentation. Next, I would like to invite Dr. Tejal Dattatray Naik for the paper presentation on the topic use of Chaturbuja Rasa in the management of pediatric seizure disorder with respect to Abhasmara.
Hello, myself Tejal Dattatray Naik, PG scholar from Kaumarvita department from GSC Dharasiv. Today's my topic is use of Chaturbhuj Ras in management of pediatric seizure disorder with special reference to the Apasmat. Epilepsy is a chronic disorder of the brain characterized by the recurrent seizures. Seizures are sudden uncontrolled episodes of excessive electrical changes of the brain cells associated with sensory, motor, or behavioral changes. Seizures are most common pediatric neurological disorder. Apasmar is such a disease which belongs to the Manoha Srotas. Apasmar can be treated with the two stages, that is Vegakal, that is Shodhana, Shaman, and Vegantarkal, Rasayan Chikitsa is mentioned. Therefore, Chaturbhuj Ras having Rasayan and Vatashamak properties selected as Shaman Chikitsa. Dushchikitsa Apasmar Chikitsartha Rasayan Prayog. Rasaushadhi. Rasaushadhi, although named after the mercury, that is Rasa or Parada. Two distinct classes are there, mercurials and non-mercurials. Based upon the method of preparation, the mercury-based drugs are classified as Khalvi Rasa, Parpati Ras, Kupipakva Ras, and Pottali Ras. From that, Chaturbhuj Ras is a Khalvi Rasa in which Kupipakva Rasa, that Suvarna Bhasma, is used as a main ingredient. Rasaushadhi are known to be useful in minute quantity, quick acting, and do not produce adverse reaction in patients due to their tastelessness. In Chaturbhuj Ras, there are the four contents, that is Rasa Sindur, Suvarna Bhasma, Shuddha Manashila, Hartal, and Kasturika, and it has two Bhavna Dravyas, that is Ghruta Kumari Swaras and Erandapatra Swaras, and Triphala Churna and honey is used as a Anupan. Rasa Sindura, it is of the Shadras, it has Ushna Virya, Madhura Vipak, Guru and Snigdha Guna. Its medicinal uses are it strengthens the nervous system, used to boost immunity and to improve the health. It acts on weak immunity, urinary tract infection, and abdominal pain. Swarna. It has Madhura Kasha and Tiktaras, Shitavirya, Madhura Vipaka, and Snigdha and Guru Guna. Its actions are Medhya, Buddha, Buddhi Smruti Prada, Balya, Aisha, Vagavani Shuddhikara, Vishagna, and Bruhana. Its medicinal uses are in muscle wasting and anemia. Hartal. Its chemical name is arsenic trisulfide. It has Katutikta Rasa, Ushna Virya, and Tikta Vipaka, Snigdha, Agnidipak, and Kushtanashaka Guna. Its medicinal uses are in Apasmara, Balavardhana, and Vatarakta Vikara Upadrav. It acts on epilepsy and spasticity of the muscles. Manashila. Its chemical name is arsenic disulfide. It has Katutikta Rasa, Snigdha Ushna Guru Guna, Lekhan and Kafahara Karma, Ushna Virya, and Vishanashak Prabhav. Its medicinal uses are as Rasayan, Agnimandya, and Kshaya. Gruta Kumare, that is aloe vera. It has Tiktaras, Madhur Vipak, Shita Virya, Guru Snigdha, and Pischila Guna. Its action are Kafa Pittahar, Rakta Shodhaka, Branaropaka, Dipan, and Pachan. Eranda, its Latin name is Ricinus communis, Euphorbiaceae family. It has Madhur Rasa, Katu Kashaya Anuras, Snigdha Tikshna Sukshma Guna, Ushna Virya, and Madhura Vipaka. And Doshagnata, its Doshagnata is Kafa Vatahara. And Karma are like Medhya, Dipan, and Shirashulahara. Kasturi, its Latin name is Moschus moschiferus. English name is musk, and family is Cervidae. Properties. It has Tikta Katurasa, Laghu Ruksha Tikshna Guna, Katu Vipaka and Ushna Virya. Its chemical composition is muscone and nor-muscone. Karma. Muscone plays important role in regulation of CNS. In small dose, its action is excitatory nerve reflex, and in large dose, it inhibits the nerve reflex. Properties of Chaturbhuj Ras. Because of the synergetic effect of all the drugs used in Chaturbhuj Ras, it acts as a best Vatashamak special effect on brain, nervous system, and mind. It is useful in treating neuromuscular conditions. It used in most of the neurological diseases relating to the brain, spinal cord, nerves. It is the best medicine on the Vata Pitta Roga, Bala Pakshagat, Unmad, Apasmar, Murcha, and Indriya Daurbalya. Rasayan, Suvarna Bhasma, Parad, Gandhak, and Hartal, and Manashila. These works as a Rasayan, and Shodit Hartal, Shodit Manashila Bhasma, Suvarna Bhasma, and Kasturi acts as a Vatashamak, and Suvarna Bhasma and Rasasindur acts as Bruhan Karma, and Suvarna Bhasma is a Medhya Dravya. Parad, Gandhak, and are the Tridoshahar drugs, and Suvarna Bhasma is also a Tridoshahar, and its action on the Dhismruti and Medha. The Raja and Tamas are also influenced by the Suvarna Bhasma and Abho Medhya Vatashamak Rasayan Bruhaniya drugs. Its action on the Srotas, the site of action of Rasayana extends up to the Manas Dosh. The relief obtained was relatively better on the ictal feature, severity, duration, and frequency of the attack. This might have been due to the Medhya and Vatanashaka Guna. Anti-epileptic activity after prolonged administration are also balances the excitatory and inhibitory neurotransmitters in CNS, the main action being GABAergic action and additional antioxidant activity of the HERDs. Conclusion is epilepsy can be correlated broadly with apasmara rog. The Ayurvedic recipe, especially with the Rasaushadhi, is significantly effective in controlling the seizure disorder of the children. It also acts as a rasayana, which helps in achieving the milestones and enhancing the catch-up growth and development. All about descriptions and rasa, virya, vipak, guna, and karma of the drugs included in the Chaturbhuj Ras has the property having broad spectrum of the action, that is rasayana, as well as Vata Vyadhihar in apasmar, kalin, veg, and apasmara. Thank you.
Thank you, Dr. Tejal Dattatray Naik. Thank you for the wonderful presentation. Next, we go to the paper presentation. Next, I'd like to invite Dr. Akash Mohan Rao Deshmukh for the paper presentation on the topic randomized controlled clinical trial to study the add-on effect of Mahapaishajika Grida along with the diet counseling in Kasha with special reference to undernutrition in preschool children.
Hello sir, hello madam. Myself Akash Mohan Rao Deshmukh, final year PG student, Kamarputya department. I am here to present my topic on randomized controlled clinical trial to study the add-on effect of Mahapaishajik growth along with diet counseling in cars with special reference to undernutrition in preschool children. Introduction. Undernutrition is a condition in which there is inadequate consumption, poor absorption of excessive loss of nutrients. The term malnutrition refers to both undernutrition as well as overnutrition. Growing children are most vulnerable to consequences. Their nutritional status is a sensitive indicator of community health and nutrition. Growth and development is physiological process provided all factors influencing them are healthy. Failure to thrive or small for age are resulting when these factors are deficient, and in Ayurveda it is addressed as scars. Both girls and boys have similar prevalence of undernutrition. Prevalence of underweight in Maharashtra, India is 64%. Need of study. Many diseases are known to afflict human beings. These include infectious, metabolic, genetic, and nutritional deficiency disorder. Out of these, nutritional diseases are by far the most common throughout the world. Among them, undernutrition is the commonest one. Undernutrition affects every system in the body and always resulting in increased complications like growth failure and stunting, delayed sexual development, reduced muscle mass and strength, risk of osteoporosis children. So, to accomplish a good and healthy future, we will conducting this study to determine the effect of treatment at the initial stage of symptoms. Mahapaisachi growth with possesses the property like Deepan Pachan, Tridoshaknam, Bruhan, Rasayan, etc. Research question. Is there add-on effect of Mahapaisachi growth along with diet counseling in cars with special reference to undernutrition in preschool children? Hypothesis. Primary. There is no add-on effect of Mahapaisachi growth along with diet counseling in cars with special reference to undernutrition in preschool children. Alternative hypothesis. There is add-on effect of Mahapaisachi growth along with diet counseling in cars with special reference to undernutrition in preschool children. Review of literature. Ayurvedic Sahita, modern textbook, reference from internet and journals. Objectives. Primary objective to study the manifestation of cars in children with Ayurvedic and modern perspective in detail. To study the preparation and analyze the effect of Mahapaisachi growth. Secondary objective to study the literature related concept of cars in children. To study the literature related concept of undernutrition. To study the concept of Mahapaisachi growth. To study the concept of Lehan. To study the concept of diet counseling. Methodology, study design, randomized control clinical study, location of study, OPD, IPD and school camp children from institution Ayurvedic hospital. Duration of treatment, 90 days with follow-up of 0 day, 15 day, 13 day, 16 day, 19 day. Sample size, 80 children diagnosed as CARS will be selected for study. Sampling technique, simple random sampling technique will be used. Randomization, computer generated randomization technique will be used. Diagnostic criteria, inclusion criteria, children between the age of 3 to 6 years, preschool children of either sex, children with less weight than expected as per age, parents, legal guardians willing to give written informed consent. Exclusion criteria, children with known case of systemic disorder, children with known case of endotracheal disorder, genetic anomalies, children with known case of immunosuppressive disorder. Withdrawal criteria, children will withdraw from study who discontinue the treatment spontaneously. Non-cooperative children, children not giving regular follow-up. If any complication occurs, then children will be treated with appropriate drug and treatment. Assessment criteria, subjective criteria, Daurbalya if present 1, Daurbalya if absent 0, feeling of hunger if present 1, feeling of hunger if absent 0. All subjective criteria will be recorded in each and every patient before and after treatment. Specific scoring pattern will be developed for the record. Objective criteria, anthropometrical measurement, weight, height, mid-upper arm circumference, chest circumference, head circumference. Data collection tools, primary data, clinical data, case record, secondary data, reference book, research article, journal, website, data analysis, Wilcoxon sign rank test, man-Whitney U test, pair T test, unpaired T test. If necessary, appropriate test will be applied. Observation and result. Observation will be done on the basis of assessment criteria. Clinically add-on effect of Mahapaisachi growth along with diet counseling will be observed and the result will be drawn by using statistical analysis. Discussion. It will be based on the data collection, observation and result. Conclusion. Conclusion will be drawn after collection of data and completion of research. Consent. An informed written consent of all patients included in trials in the language best understood by them will be taken. Drug review. Mahapaisachi growth. अष्टांग संग्रह उत्तर तंत्र 9वा अध्याय 33 ते 36 श्लोक. जटिला पूतना केशी चारटी मरकटी वचा त्रायमान जया वीरा चोरक कटुरोहिणी कायस्ता शूकरी छत्रा अति छत्रा पलंकशा महापुरुष दंताच वयस्था नाकुली द्वयम कटंबरा वृषकाली शाली पर्णीच तयगुतम सिद्धम चतुर्थकोन्माद ग्रह पस्मारम नाशनम महापैशाचक नाम घृतमेध्यामृतम बुद्धि मेधा स्मृतिकरम बालानां चंग वर्धनम drug preparation phase. The authentic raw drugs will be purchased from the market. Grits will be prepared in the Rasashala by Sajja Kalpana department of our college as per standard method by Sarandra Sanhita. Dose and duration. Group dose in 3 to 6 year children calculated by using Clerk's rule. Child dose is equal to weight in pound divided by 150 into one adult dose. The Anupan honey will be given as needed according to the quantity of trial drug. According to this formula, group doses are recommended for medication use. Matching criteria. Group A 40 patients, Group B 40 patients. Group A will given Mahapaishachi group along with diet counseling. Group B will given only diet and counseling. Anupan honey duration 3 months. Follow 0 day, 15th day, 13th day, 16th day, and 19th day. Thank you.
Thank you, Dr. Akash. Thank you for the wonderful presentation. Next, I would like to invite Dr. Kamini Chanu Bagul for the paper presentation. Dr. Kamini Chanu Bagul, are you there? Dr. Kamini Chanu Bagul, are you there? Next is a paper presentation. I would like to invite Dr. Amrita Mardi Padage for the paper presentation on the topic Avabahuga Frozen Shoulder Review.
Hello everyone, my name is Dr. Amrita Mariti Padki, PG Scholar, Department of Panchakarma, from the Institute of Honorable Shri Rasayan Chikitsa Ayurvedic Medical College and Postgraduate Training Research Center, Ashta, District Sangli. My guide name is Dr. Archana Valkar, Associate Professor from Department of Panchakarma. Okay, my paper title is Obahu vis-a-vis frozen shoulder review, means Ayurvedic and modern review of Obahu. Abstract. Obahu, disease of shoulder joint, is a common musculoskeletal disorder that can significantly impair daily activities and productivity. This condition, described by Acharya Sushruta as one of 80 types of Vatvadi, shares similar clinical presentation and pathogenesis with frozen shoulder. Introduction. Obahu, a term coined by Acharya Sushruta, this is a condition affecting the shoulder joint commonly encountered in general practice. The term refers to the lodging of fat at the root of shoulder, constricting pains and leading to loss of movement. In Ayurvedic ways, Obahu is described as a condition characterized by dryness and stiffness of the shoulder ligament, tendon, and connective tissue, resulting in pain and reduced blood supply. It is also mentioned by Madhav Nidan, Charak Sanhita, and Chakra also describe this condition as a Bahu Shosh and Bahu Vat respectively. According to Acharya Sushruta, vitiated vat in and around the shoulder causes shosh and constriction of blood vessels leading to Obahu. This paper aims to provide overview of nature and widely accepted management strategies for Obahu based on existing studies. Etymology of Obahu. It is made up of two words, Ava and Bahu. The prefix Ava means away, down, retreat, off, or away. All that means like dysfunction or physiological separation, not anatomical, resulting in movement restriction, hampering one's all activities of that particular part, as if there is a real separation. Therefore, Obahu means immobile shoulder. Nidan. Causes of above is mainly Vatdosh as it is described under Vatvadi, and in later stage Kaphadosh is also associated with Vatdosh. The causes of above may be classified in three groups. Abhigatash means coma, Aharaj means unwholesome food, Viharaj like improper lifestyle, and other few factors like Lavan, Bharvahan, Balvat, Vigraha, Dukhashaya. Pathogenesis means Samprapti of above. According to Acharya Sushruta, vitiated vat around the shoulder joint depletes structure or tissue in and around it, and the vasoconstriction of vessel leading to pain and stiffness of the shoulder joint, ultimately resulting in restricted shoulder movement. Purvarup is none. Root of Bahu, sign and symptoms. First one is pain, shoulder stiffness, restriction in shoulder joint, and shosh. The Ayurvedic text recommend various treatment for Vatvadi, including Snehan, Basti, Nasya, Abhyanga, Nasya Karma, Yog, Asana, shoulder exercise, Agnikarma, Marma therapy. In addition, a broad overview of some well-recognized methods today includes massage, stretching, deep breathing, avoidance of causes, wholesome diet, and activities like. Now, modern perspective of frozen shoulder. Introduction. Frozen shoulder, also known as periarthritis scapulohumeral, is a condition characterized by synovial inflammation and fibrosis of the shoulder joint capsule. The exact cause of primary frozen shoulder is unknown, but it may be related to partial loss of blood supply. The condition typically progresses through three phases: painful, frozen, and thawing means recovery. This condition can be classified into primary and secondary types, with primary cases having no obvious cause and secondary cases having identifiable cause. In clinical practice, it is essential to accurately diagnose frozen shoulder and differentiate it from other shoulder conditions such as rotator cuff tear or osteoarthritis, which is required distinct management approach. Pathology of frozen shoulder. Pathophysiological process involves synovial inflammation and fibrosis, with fibroblast and mast cell present. Cytokines like TGF, beta, and PDGF may contribute to inflammation. While the glenohumeral joint capsule is involved, the disease also affects surrounding structure outside the joint, including the coracohumeral ligament, rotator interval, subscapularis, musculotendinous junction, and subacromial bursa. This multifactorial involvement leads to stiffness, pain, and limited mobility in affected shoulder. Etiology. The cause of idiopathic form of this disease is unknown, whereas the condition that can lead to secondary frozen shoulder are systemic disease, like diabetes, hypothyroidism, etc. Clinical pictures. The diagnosis is made on the basis of medical history, clinical and radiological examination. Clinical pictures are like shoulder pain, pain felt at deltoid insertion, inability to sleep, atrophy of the supra and infraspinatus muscle, sometimes minimal local tenderness, restriction of active and passive ROM, a painful and restricted elevation and external rotation. Management. Generally, this disease is self-limiting condition, but patient education is most important as it encourages compliance, informing the patient about the phases, course, and duration. It is also imperative to emphasize that while the range of motion will improve, it may never be complete. Treatment. According to modern science, a decision regarding the best treatment option depends on the stage of the disease and clinical symptoms. Intra-articular steroid and physiotherapy in stage 1, intra-articular steroid and arthroscopic release in stage 2, arthroscopic release in stage 3, monitoring progress and active physiotherapy in stage 4. Medication is like intra-articular steroid, physiotherapy, hydrodilation, oral steroid, electric stimulation, surgery, manipulation under anesthesia, arthroscopic selective capsule, release. It has become the main surgical option in treatment of adhesive capsulitis. Discussion. This paper provides an overview of the nature and management of frozen shoulder, considering the patient's symptoms and condition when selecting treatment. Marma therapy stimulating nearby points has shown promising results and can be used lifelong without side effect. It can be combined with oral medication and medicated oil. Shoulder exercise can be used in all stages. While Marma therapy shows promise, there is a limited evidence to prove its long-term effect, and future research is needed to compare its efficacy with the randomized controlled trial. Thank you.
Thank you, Dr. Amrita Bhatke. Thank you for the wonderful presentation. Next, we go to the Janu Sandhigatavada related paper presentation. I would like to invite Dr. Rupesh Khadge for the paper presentation on the topic Role of Januvasti in Janu Sandhigatavada or osteoarthritis of knee joint, a case study.
Paper presentation. Myself, Dr. Rupesh Subhash Khadke. My guide name is Dr. Alaknanda Kulkarni. My college name is Honorable Shri Anna Sahib Dange Ayurvedic Medical College, Ashta. My topic name is Role of Janu Basti in Janu Sandhigatvat, osteoarthritis of knee joint, a case study. Introduction. Janu Sandhigatvat is a type of a Vat Vyadhi, occur only in people of age between the 40 to 60, but people in their 20 to 30 year also suffering from the Janu Sandhigatvat. Janu Sandhigatvat is one of the 80 types of the Vat Vyadhi. Janu Sandhigatvat is word derived two terms. Janu means knee joint and Basti means hold. Thus the Janu means treatment in which the medication oil is poured and pulled for the fixed duration of a time in a component or the cabin constructed around the knee joint. Januvasti is listed a Bahir Parimarjan Chikitsa is a type of Bahya Snehan and the Swedan external oil application at the sudation. Lateral, according to the other Janubasti, is considered as a Snigdha Sweth. Case study. A male patient of a 60-year-old came to our institute, complaints, difficulty in walking with severe pain, crepitus palpable over the bilateral knee, which worsen with movement and the relieving by rest. Since last 1 year, family history, mother and father, no history of illness, past history, no any surgical, any diabetic, any hypertension history, personal history, no any addiction, diet is vegetarian, bowel evacuation 2 times per day, occupation farmer. Center of study, the Honorable Sri Anna Sahib Dange Ayurvedic College postgraduate and the research center Ashta Sangli. A simple random single case study. Examination. General examination. When the patient came to our OPD, we have the through examination and complete history was taken. The patient was the supportive and oriented to the time and place. Vitals: temperature 97.3, pulse 86 per minute, respiration rate 18 per minute, blood pressure 130 by 18 mmHg. अष्टविध परीक्षा: नाड़ी 86 per minute, मूत्र 1 to 2 time per day, मल 1 to 2 time per day, जीवा निराम, शब्द नॉर्मल, स्पर्श नॉर्मल, दृक नॉर्मल, आकृति मध्यम. Subjective criteria: we categorize in the different terms, the shul, shoth, crepitus, tenderness and gates in different grades like 0, 1, 2, 3. The shul, 0, there is no pain, mild pain, moderate pain, severe pain. Shoth, likewise the no pain, no swelling, mild, moderate, severe. Crepitus, no crepitus, palpable crepitus, audible crepitus, always audible crepitus. Tenderness, no tenderness, patient complaint pain on touching, patient withdraw joint on touch, patient does not allow touch the joint. Gates: free swinging, no limp, limping gait with no additional support, limping gait with unilateral support, limping gait with bilateral support. Treatment given: we give the Abhyantar Chikitsa and Panchakarma Chikitsa. In Abhyantar Chikitsa, in this case study, given oral medication during the treatment. Tablet Yograj Gugul 250 mg BD after meal. Tablet Asti Poshak Vati 1 OD after meal. Capsule Shallaki 400 mg 1 BD. Maharasnadi Kot 10 ml in BD after meal. Procedure of Janobasti: Purva Karma, Pradhan Karma and Paschat Karma. This is the image showing in slide the Janobasti image first and Janobasti image second. Observation and result: we divide that subjective criteria before treatment and after treatment. Before treatment in right knee and left knee, after treatment in right knee and left knee. Likewise the shul, that is pain, is before treatment of right is 2 and after treatment of right is 0, and before treatment of left knee is 3, after treatment is reduced to 1. Shoth in left knee is 1, that's reduced to 0. Crepitation is right and left knee are 2 gradation, and same as after treatment is decreased to 1. Tenderness is right and left knee is 1 and after treatment is reduced to 0. Gait is the left knee is 1, that reduced to the 0. All study objective parameters showed a significant difference after 7 days of treatment. Pain was significantly reduced. Whether tenderness was released completely. Walking performance of the patient was significantly improved. Swelling was significantly reduced in the knee joint. Discussion: osteoarthritis is the chronic degenerative changes in our daily life. The disease affect the weight-bearing joint and the largest joint of the body, such as the hip joint, knee joint, shoulder joint. The most common symptoms are the joint pain, stiffness, which develop over the time. These clinically manifestation are closely related to the disease of Janu Sandhikatvat. The latter, Janu and Basti, has a unique meaning. And the compare Snehna and Svedana, or it can be written like this is the Snehi Yukta Svedan or the Snigdha Sved. Especially Snehna, especially for the behavior of the Rukshagun of Vata, and Svedan act against the Shitagun. In Sandhikatvat, it's completely destroy the Vat dosha, that is the Rukshagun. So for this we can use the Sahacharadi Tel or the attribute of a Vat Shaman and Vedna Shaman. In this patient, there was a moderate pain over the knee joint, hence the Yograj Gugul, Asti Poshakoti and Maharasnadi and Shallak is given. In this case study, patient initially has the severe pain with swelling over the joint. After 7 days Janubasti, this patient is significantly relieved. Conclusion: Janubasti, Janugat Vat, that is the knee osteoarthritis, is a weakness and interference with the daily activity. It is very prevent musculoskeletal disease in elder people. It is chiefly caused by vitation vata dosha. This is the conclusion of this case study. Sarchar Til Janu Basti. Treatment should be affordable and accessible and nil or the minimal side effect. The case study is example of osteoarthritis treatment, knee joint. This will be improve the quality of the life of patient. Thank you.
Thank you, Dr. Rubesh Katke. Thank you for the wonderful presentation. Next is a literacy management related paper presentation. I would like to invite Dr. Aishwarya Santosh Sagwekar for the paper presentation on the topic Role of Shiraveda Rekta Mokshan in Instant Pain Management in Gridrasi, a case study.
Good evening everyone. Myself Dr. Aishwarya Santosh Sagwekar, Panchakarma Department PG Scholar. Under the guidance of Dr. Shankar Manesar from Honorable Shri Anna Sahib Nange Ayurvedic Medical College, Postgraduate and Research Training Center, Ashta, Sangli. Today I am going to present on role of Shiraveda Rakta Mokshan in instant pain management in Gridrasi, a case study. Sciatica, that is Gridrasi, is a condition where there is a distribution of pain along the course of sciatic nerve which radiates from low back to buttock and leg. It is the largest nerve in body and compression of sciatic nerve leads to sciatica which causes difficulty in walking. It hampers the daily routine and deteriorates quality of life. According to Bhel Samhita, Rakta Mokshan is the best treatment for Gridrasi. By Shiraved, all the diseases will be cured from their roots, just like rice and other crops in the field dry out completely by removing the bunds of field. The causative factors are overexertion, excessive jerky movements during traveling, lifting heavy weight, irregular food habits, stress, lack of proper sleep, creates impact on body. Lumbar region is most affected because of exposure to mechanical stress, which leads to the most common musculoskeletal disorder, that is lumbar spondylosis. And lumbar spondylosis is the most common causative factor of sciatica. I am going to present a case where a 67 years old male patient was apparently normal before 12 days. Gradually, he started complaining of severe lumbar pain, which followed by radiating from lumbar to gluteal region, radiating to right leg. Difficulty and pain while walking and sitting, heaviness in both legs, stiffness in lumbar region. So patient came in Panchakarma OPD of Ayurvedic hospital. His known case is hypertension under treatment since 12 years. No any history of trauma. Occupation is farmer, no any family history, no social history like smoking, alcohol, tobacco, chewing, and patient is vegetarian. When patient came to OPD, he was thoroughly examined and complete history was taken. Patient was supportive and oriented to time and place. Temperature was febrile, pulse 84 per minute, RR 20 per minute, and BP was 136 by 86 mmHg. Ashtavid Pariksha, Nadi was Vata Pittach, Mala Samyak, Mutra Samyak, Jiva Niram, Shabda Spashta, स्पर्श अनुष्ण, धृक सम्यक, आकृति मध्यम. Musculoskeletal examination SLRT, the right leg was 10° positive and left leg was 70° positive. Ruka was present on right more and left is comparatively less than right. Stambha was present on both left and right. Right was comparatively more. Suptata was present on right lower limb. Chimchiman was present on right lower limb and Gavrata was also present on right lower limb. Hetu was Ruksha and Katutikta Ras Ahar, Ati Chankraman, hard work in farm and riding on vehicle. The Samprapti Ghatak is Vatadosh, Rakta Mamsa Asti Majja Kandra Shira Snayu Dushya, Kati Uru Janga Pada Adhishtan, Raktavastrotas, Mamsavastrotas, Medavastrotas, Astivastrotas and Majjavastrotas. The treatment given was in Abhyantar Chikitsa, capsule palsy neuron 1 TDS after meal, Sudshekar Ras 2 BD before meal, Gandharva Haritaki 1 HS, Lep, Bajrang Lep, in which Vatanashak ingredients are there like Nirgundi, Rasna, Eranda, Dashamul, plus Adrak, plus Rasun, 10 to 8 bulb over lumbar region. In Panchakarma Chikitsa, Nadisved with Dashamul Kwat over Kati and Ubhayapad and Siraved from Dakshinpad. Siraved done on the first day itself. Requirements for Siraved was intravenous cannula number 20, 10 cc syringe, tourniquet, kidney tray, disinfectants, bandage materials, cotton. Preparation of the patient. Initially, the patient is subjected to Nadi Swed. This is followed by Rakta Mokshan therapy. Nadi Swed is given only because to do dosh utkleshan over peripheral region, that is Shakagat dosh. Site Dakshin Pada for Angul, 4 Angul below Janu Pradesh. The selected vein is to be punctured. Rakta Mokshan by the method of Siraved is always preferred in the morning hours following light. Procedure: position of the patient, blocking the vein, aseptic measures, stroking the vein, puncturing the vein, observation of the patient. Observations were SLRT, right lower limb is 30° positive and left lower limb was 70° positive. The results before treatment and after treatment. Ruka, where before treatment there was severe Ruka. After treatment, after doing Siraved, pain was gradually reduced. Stambha was gradually reduced. Suptata, Chimchimam and Gaurata was absent. The mode of action of Siraved is Rakta, Kandra, Snayu, Sira are main dushya in Gridrasi. Kandra is Upadhatu of Rakta. Now Chakrapani mentions that Kandra may also consider as Stula Snayu. Snayu is Upadhatu of Meda and Mulastan of Mamsadhatu. Siraved eradicated the vitiated Pitta and Vatadushta Rakta, reduces the pain immediately, improves blood circulation and prasadhan of rasa and rakta. Discussion. Sciatica is a neuralgic pain, starts in the back region and radiates along the posterior aspect of limb to heel. Occurs due to irritation of sciatic nerve. This causes pain in sacral region, twitching pain in calf region, backache, and also leads to rukshata, kharata in lumbar vertebrae due to vitiation of vata. The treatment principle like Rakta Mokshan Siraved is used in above case by considering the stiffness, spasm and pain developed due to Vatadushit Rakta Dosh in lumbar region. On first day, Siraved was done on Dakshin Pad 4 Angul below Janu Pradesh. Stiffness in lumbar region was grossly decreased and range of motion in lumbar spine increased. There was also improvement in walking and SLRT and radiating pain also subsides. Conclusion is Vrudrasi is one of the diseases which causes disability and disturbing quality of life of patient. Acharya Shushruta mentioned that the diseases in which Snehan, Svedan and Lepadi Kriya is ineffective, Siraved can give quick relief. In this case, study Siraved with Shaman Chikitsa has shown highly significant results in walking capacity, stiffness and radiating pain. and pain is one of the most uncomfortable factors for patient. Thank you.
Thank you, Dr. Aishwarya Santosh. Thank you for the wonderful presentation. Next, we go to the Padya related poster presentation. I would like to invite Dr. Ankita Srikanth Vidkar for the poster presentation on the topic Importance of Padya in today's era.
Good evening, all of you. Myself, Dr. Ankita Vidkar, third year PG scholar in Kriya Shari department from GSC Dharashu. I am presenting here the topic Importance of Patya in today's era. As we know that Ayurveda is a holistic science of life, and the aim of the Ayurveda is Swastasya Swasthya Rakshanam Aturasya Vyadhi Paramokshanam. That means, in general word, prevention is better than cure. To fulfill this aim, Ayurveda describes various concepts. One of them is Patya and Apatya. Various Acharya describes about the Patya and Apatya. Acharya Charak mentioned that Patya is a Chikitsa. Like Patya Ahar, he had given equal importance to Patya Vihar also. Acharya Shushruta described whole Adhyay about Patya, that is Hita Hiti Adhyay. Acharya Kashyap said that Ahar is a Mahabheshaj. Acharya Hari described that if a person is taking only medicine which are prescribed to him by physician and avoiding Patya, then he cannot be healthy. Acharya Bhel said that Patya helps in detoxification of the body by getting rid of pituitary dosha. Acharya Yogratnakar said, Nidan drugs Patya, proper combination of those cause successful eradication of disease. Vaidya Lolindra said that if a person eats healthy food, they don't need medicine, and if they eat unhealthy food all the time, they don't need medicine either. In last case, medicine won't be successful. This is all about the importance of Patya in ancient era. But in today's era, we all know about Patya and Apatya. Firstly, what is meant by Patya and Apatya? Patyam patho anapetam yadda cha uktam manasaha priyam yaccha apatyam apriyam cha manasaha shanayatam tanna lakshe. This is from Charak Sutrastham 25th Adhyay, that is Yajya Purushya Adhyay. That means Ahar Vihar, which is good for person's health and cheers his mind, is Patya, and opposite to that is Apatya. Here I have mentioned some examples of Ahar Vihar from Sadapatya, Apatya, Ahar and Vihar. We can see here in Sadapatya Ahar Dravya is Mudka, Madhu, Shali and Dugdha. In Sadapatya Vihar is Pratimarshanasya, Vyayam and Nidra. And Sadapatya Ahar Dravya are the Dadhi, Vallura, that means Shushka Mams, Shushka Shak and the Kamalnal. These are all means healthy individuals can be used and consume this on daily basis. Now come to the wholesome Ahar and Vihar. Means which Ahar Vihar is best in that Anna Varga. We all know that various Acharya describe about Anna Varga. Here I have given some examples from that Anna Varga. In the Kanda Varga, Adrak is wholesome and Alu means potato is unwholesome. And in Phala Varga, Mrudvika means raisins are wholesome and Nikochi is unwholesome. Coming to the wholesome Vihar, that is Snan, Abhyanga and Kalbhujan, etc. We have seen here Patya and Apatya, but they are variable according to the Matra, that means quantity. Kal means time, Bhumi means habitat, Deha means body, Dosh, state of dosha, Kriya means working capacity of person. And we should know that this Patya Apatya according to the season and disease. That means season wise and disease specific Patya and Apatya. I have taken the Grishma Rutucharya for an example. In Grishma Rutu, we have to avoid the Katu Amla Lavan Ushna Dravyas and Madhya also. We follow the Shita Dravyas Nigdahar like Mantha, Ghruta and Dukta. Now coming to the disease specific Patya and Apatya. I have taken for an example diabetes.
Pathya in diabetes are haridra, karvellak, amalki, and apathya are ma, shale, that means rice and madhya. These all lead to the healthy and stress-free life. According to the Ayurveda, this concept of pathya are still relevant and significant in modern era. The reason for this, I will tell you. First is the prevention of lifestyle disorders like diabetes, obesity, cardiovascular diseases, and stress by using this healthy diet and way of living. Second one is immunity boosting. This nutrient-rich food can strengthen immunity, which is essential in this era for rising pollution, stress, and exposure to toxins. Mental health and well-being is the third reason. In today's hectic society, mental health problems like anxiety and depression are common. That means practice of pathya encourages mental equilibrium. Managing chronic ailments. A lot of people nowadays struggle with long-term medical ailments like hormonal imbalance, autoimmune diseases, and digestive issues. The management of these diseases can be assisted by adhering to pathyas. Lastly, concluded that the principle of pathya, ahar, vihar are highly relevant in today's era as they offer a holistic approach to health, disease prevention, immunity boosting, and personalized care based on Ayurvedic principles. By incorporating these guidelines into daily life, individual can enhance their overall well-being and maintain a healthy lifestyle in modern world. Thank you for giving me the chance to present this topic.
Thank you, Dr. Ankita Vidkar, for the well-explained poster presentation. Next, we go to the Grishma Ridhucharya related poster presentation. I would like to invite Dr. Ashmi Gunavant Ahirao for the poster presentation on the topic Grishma Ridhucharya.
Namaskar, I am Dr. Rashmi Ahirrao. Today, through my poster presentation, I'll be telling you the best practices for summer season, that is Grishma Ritucharya. Grishma Ritu is considered as peak summers according to the Ayurveda. It is the last Ritu of the Uttarayan Kal. It is the time when our body has the intense feeling of tiredness due to the strong intensity of the sun. In summer season, our body has reduced strength due to the moisture loss. In our body, the Kapha dosha decreases and Vata dosha starts accumulating. And that's why the bulk of our body is in the summer season. So, to compensate this, Grishma Ritucharya is being stated. Now, let's see what diet is recommended for the good health in the Grishma Ritucharya. Now, what is recommended diet? That is Pathya Ahar in Grishma. Consume food that has Madhur Ras and has cold potency. Dravyas like milk, ghroot, takra is really very helpful in this season. Raktashali, that is rice, is preferred. It is useful to consume Sheet Jal. Sheet Jal along with flowers of Patala and Karpur is also useful. Now, what is the Apatya Ahar? That is the food which is to be avoided. Please avoid spicy, salty, sour and pungent flavors. Avoid consuming excess curd. Avoid any food that has hot potency. Now, let's see what is the recommended lifestyle, that is Pathya Vihar for the Grishma Ritu. During daytime, stay in cold places. Diva swap, that is, you can take naps in daytime also. Sleep under the moonlight during the night. Apply chandan lake to the body. Wear jewelry made up of pearls and corals, which is cooler in nature. Visit the cool forest areas and water bodies filled with flowers. Now, let's see what is apatya vihar, means which vihar is not recommended during this season. Exercise should be avoided as it produces more heat in our body. Roaming in sunlight or excessive exposure to the sunlight for a long period of time during this season, and Vyavai is also avoided. Thank you.
Thank you, Dr. Rashmi. Thank you for the wonderful presentation. Next, we go to the Grihani related poster presentation. I would like to invite Dr. Rupali Sanjay Ingale for the poster presentation on the topic lifestyle modification in Grihani.
Good evening, everyone. Myself, Dr. Rupali Ingle, third year PG student, Drapagun Department from Pravra Medical Trust, Ayurvedic College, Shalgaon. Today, I am here to present a topic, lifestyle modification in Grihani. Grihani Roga is a chronic disease widely explained in Ayurveda by our Acharyas in Samhita, which refer to disease while occurring in Grihani due to the ventilation of Agni. Grihani Roga is a prime disease of gastrointestinal tract, among which are most often found in our day-to-day life or practice. Grihani and Agni are come under the Ashtra-Ashriya Bhav. Jatharagni rules the process of digestion supported by three doshas. Grihani is a disease due to chronic imbalance of three doshas, which impacts the function of Jatharagni. Here are some main causes or basic causes which are explained for the Grihani Roga. We can see faulty diabetic habit, junk food, chilled food, drinks, alcohol and drug abuse, sedentary lifestyle, unhealthy work environment, unhealthy work hours, increasing screen time, mental stress, anger, depression, overthinking. Same as it is explained in our Ayurvedic Samhitas like abhojanat, ajirnat, atibhojanat, vishamashanat, prathimasanat, अतिमैथुनात देशकाल ऋतु वैषम्यात असात्म्य गुरु शीत अतिरुक्ष संदुष्ट भोजनात वेगधारणात कटु तिक्त कषाय आम्ल क्षार भोजनात. Now we are seeing symptoms which mainly seen in Grihani like udar, shut, ज्वर, प्रसिक, अपचन, आस्य वैरस्य, विस्तंभ, अरोचक, आलस्य, उदरबाहुल्य, हस्तपाद शूल, तृष्णा, मल, अतिवृष्टम, vibandham, drava. Now we are seeing the main points which are lifestyle modifications in Grihani. First, modification in diet pattern towards the unhealthy eating habits boosts the Agni and prevents the chances of Grihani. Second, junk food, allergy food and food difficult to digest should be avoided. Third, diet containing balanced nutritional value need to be adopted. Fourth one, behavioral factors such as fear, grief, stress, and sleeplessness may lead to symptoms of Grihani. Therefore, one should avoid the stress, fear, and grief to disrupt condition of depression which may affect the Agni. Fifth, be happy and associate with the mental and empowerment activities. Sixth, daytime sleeping and light night awakening should be avoided, which we are seeing nowadays is mainly caused And the last not but least, but very important in all type of health condition, we should follow this yoga and meditations. So I'm really thank you for giving me chance to present the topic. Thank you.
Thank you, Dr. Rupali. Thank you for the wonderful presentation. Next, we go to the PCOS management related paper presentation. I would like to invite Dr. Yogita Jayesh Lembur for the paper presentation on the topic role of Dehavayam physical exercise in the management of PCOS.
Good evening, all of you. Myself, Dr. Yogita Jayesh Lambur, PG scholar of a Stree Rog and Prasuti Tantra Department, LRP Ayurvedic College and Hospital, Sangli. I am going to present role of Deha Vyayama, that is physical exercise, in the management of PCOS, guided by Dr. Hemalata Kungi, HOD and Professor of Stree Rog and Prasuti Tantra Department, LRP Ayurvedic College and Hospital, Sangli. Abstract: the PCOS is the most common endocrine disorder in a reproductive age of women. It is described in 1935 by Stein and Leventhal as a syndrome which includes amenorrhea, obesity associated with enlarged polycystic ovaries. As per Rotterdam criteria, it is frequently associated with insulin resistance and obesity. Deha Vyayama, that is physical exercise, is an important line of approach in managing PCOS. Introduction: in the present era, modernization has an important part in the lifestyle. In the day-to-day life of a woman, she has to bear more responsibilities, due to which she has lack of exercise, stress, and consuming high-calorie food. Stress, obesity, lack of physical and mental exercise can unstabilize the function of HPO, that is hypothalamus pituitary ovarian axis, that is endocrine dysfunction, which may cause PCOS. Ayurveda has a main objective of swasthasya swasthya rakshanam aturasya vyadhi paramokshanam. Deha Vyayama is a complete prescription for healthy body and mind, which destroys main cause of PCOS like obesity and HPO axis dysfunction. Modern medical science has no ailment to cure PCOS, they only do symptomatic treatment, and it has side effects and it is costly too. On the other side, Deha Vyayam has no side effects and has no cost. Physical exercise is effective in keeping ovary and uterus healthy. Aim: to understand Deha Vyayama, that is physical exercise, is one of the important management in PCOS. Objectives: to establish the importance of Deha Vyayama in the management of PCOS, to know the Deha Vyayama in detail, to know a mode of action of a Deha Vyayama on the root cause of PCOS like obesity, insulin resistance, HPO axis dysfunction. Materials and methods: all relevant data regarding PCOS Deha Vyayama is taken from articles, journals and books, etc. Etiopathogenesis: obesity and insulin resistance, which is commonly associated with PCOS, specifically hyperinsulinemia, increase gonadotropin releasing hormone in pulsatile manner frequently. LH over FSH dominance, increase ovarian androgen, decrease follicular maturation, and decrease SHBG, that is sex hormone binding globulin, which further cause PCOS. Mode of action of Deha Vyayama: in the modern era, women are mainly consuming calorie-rich items and not having exercise regularly. which worsen tissue metabolism of a body, including reproductive system. Devayama brings coordination of muscular system with nervous system and helps to combat insulin resistance, help in a weight loss and correction in HPO axis dysfunction. Discussion: Devayama increase the blood flow to the organ, significantly decrease the blood sugar level and increase the insulin sensitivity, improves BMI ratio. Devayama, that is physical exercise, includes stretching and releasing muscle of a body, which increase blood flow and improves the function of organs. Conclusion: regular Devayama helps to tone up the whole body and mind. Women diagnosed with PCOS has profound obesity, insulin resistance, and HPO axis dysfunction. Devayama is a mean preventive and therapeutic treatment for PCOS as it causes weight reduction, regulates HPO axis function. Thank you.
Thank you, Dr. Yogita J.S. Lembo. Thank you for the wonderful presentation. Next, we go to the paper and poster presentation. First, we go to the poster presentation. I would like to invite Dr. Ankita Lakshman Bandari for the poster presentation on the topic lifestyle modification in Amla Pitta.
Good evening to the respected panel. I am Dr. Ankita Lakshman Bandari, MD Swastaruttan Yoga final year from College Yashwant Ayurvedic Medical College, Kodoli, Kolhapur. Today I am going to present my poster on the topic of lifestyle modification Amla Pitta under the guidance of my HOD and guide Dr. Kalpana Jadhav ma'am. So here I am continuing the topic of lifestyle modification Amla Pitta. So firstly, we come to the hetus. Viruddha dushta amla vidaha, pitta prakopa pinna bunno vidagdam, pittam swahetu pachitam pura yat amla pittam pravadanti santam. So the hetus are vidyanna, having pitta increasing food, stale food, poisonous food, tikta katu amla food, awakening late night, vega vidharan, adyashan, viruddashan, dushta bhojan, अति उष्ण अति स्निग्ध अति रुक्ष अति द्रव अन्न heavy to digest food abhishandi food sleeping right after having food excessive intake of alcohol and smoking. These are the most common dangerous hetus for the amla pitta, like vidyanna, having pitta increasing food which includes the spicy food, stale food, or tikta katu amla food, which are the rasas. Tikta katu amla हेतु प्रकोपक for the आम्ल पित्त. अवेकनिंग लेट नाइट रात्रि जागरण, वेग विधारण, अध्यशन और उपवास, विरुद्धासन, दुष्ट भोजन, अति उष्ण अति स्निग्ध अति रुक्ष अति द्रव अन्न, which are the similar gunas of the pitta, so they can prakop the pitta. Heavy to digest food, abhishanti food, sleeping right after having food, excessive intake of alcohol and smoking.
Thank you, Dr. Ankita. Thank you for the wonderful paper presentation. Next, we go to the poster presentation of Dr. Ankita.
Good evening to the respected panel. I am Vaidya Ankita Lakshman Bhandari, MD Swasthuruttan Yoga final year from the college Yashwant Ayurvedic College, Kodoli, Kolhapur. Today I am going to present my paper on the topic of Aharami Aushadam under the guidance of my guide and HOD Dr. Kalpana Jadhav ma'am. So I am presenting the topic Aharami Aushadam. So the abstract says, Ayurveda is an ancient science of all the Ayurvedic concepts. Trayopastambha is the most important since it is based on three principles. That is Brahmacharya, celibacy, Nidra, sleep, and Ahar is a diet. So the topic highlights the Ahar, the one Upastambha from the Trayopastambha, diet. These three pillars determine one's lifespan and level of enjoyment. Ahar secured the top spot in the Trayopastambha. Thus, we need to be familiar with the Ayurvedic Ahara, that is diet. Eating a non-wholesome diet can cause illness, but following a healthy diet plan can help you stay well. Power, radiance, and oja are given to the body by Ahara. It also boosts mental fortitude and is necessary for longevity. Dravyabhuta Aushadh is a category that includes Ahara Dravyas. Therefore, for Vikara Prashman, the dietary guidelines can be regarded as Upay or Dravyabhuta Aushadhi. The 8 dietary components known as Ahara Vidhi Vishesh Ayatani are thought to be responsible for both health and sickness. Ahar is regarded as the superior medicine, Mahabhaishaj. That is why I selected the topic is Ahara Aushadam. I wanted to highlight that Ahar can act as Aushad also. That is why Mahabhaishaj. Inadequate eating and lifestyle choices lead to a host of lifestyle disorders and diseases that can be avoided with appropriate ahar and eating practices. Ayurveda maintains that the individual's prakriti or constitution should be taken into consideration when selecting an ahar. The purpose of this article is to examine the significance of the ahar as a aushadhi. Food or ahara is essential for sustaining life and preserving the body's regular physiological processes. Ahar offers durability, skin tone, containment, sturdiness, energy, and immunity. In addition to offering nutrition, Ahar also promotes growth and development, guards against infections, boosts sense organ function, and promotes both physical and emotional well-being. Ahara offers health benefits due to its nutritional content. Nevertheless, improper preparation or consumption of food does not result in substantial health benefits from that food. सो याच्यावरून एक गोष्ट कळते की जर तुम्ही तो जो काही आहार आहे जो काही डाएट आहे तुम्ही अत्यंत उत्तम पद्धतीने किंवा उत्तम प्रमाणात प्रपोर्शनमध्ये जर घेत असाल तर ते औषधासारखंही काम करते. पण जर तुम्ही इम्प्रॉपर अयोग्य पद्धतीने त्या गोष्टी आहार बनवत आहात किंवा अन्न शिजवत आहात भोजन बनवत आहात तर ते आरोग्यासाठी हानिकारक सुद्धा ठरू शकते. The significance of ahara according to acharyas. According to Ayurvedacharya Vagbhat, Ahara, Nidra and Brahmacharya are 3 pillars of human wellness. Ahara Shaina Brahmacharya Yukta Prayojite, Shariram Dhatu Tejan Magara Jam Avadharani. The body is supported in the same manner that a home is supported by pillars, by carefully employing these 3 in accordance with the instruction found in scripture. The body maintains its power, brilliance, and conformation throughout life by employing these 3 upastambhas. However, the mentioned advantages are occasionally unavailable if an improper diet and lifestyle are followed. Ahar is also required for bala, varna, upachaya, etc. other things. All dravyas are aushad is according to Acharya Charaka. Traya upastambha ijat ahare swapno brahmacharya mujata. एतद्भिः जैर उपस्तम्भैः शरीरं बलवर्ण उपचय जब तनुवते यावद्दाय संस्कारं जन उपसेवमान्यस यहि वोपदेक्षते. According to Charaka, ahar, all dravyas are aushad if taken in a proper manner and proper proportion, and they can be divided into 2 categories based on their composition: adravyabhuta aushadhi and dravyabhuta aushadhi. Dravyabhuta aushadhi is the category that ahar dravyas fall under. Thus, for vikara prashaman, that dietary guidelines might be regarded as upay or अद्रव्यभूत औषधी. तर द्रव्यभूत औषधीच्या कॅटेगरीच्या खाली जे काही आपण आहार घेतो, जे काही अन्न घेतो, ते सगळं काही त्या द्रव्यभूत औषधीच्या अंडर येतं. आणि विकार उपशमनासाठी जे काही डायटरी गाईडलाईन्स आहेत त्याला आपण उपाय किंवा त्यालाच आपण अद्रव्यभूत औषधी असं म्हणतो. Acharya Sushruta described the advantages of having a healthy ahar in the Sushruta Sahita. Sushruta states in Sutrasthana chapter 46 that food nourishes the body, produces strength rapidly, maintains the body and enhances age, sharpness, enthusiasm, memory, energy and fire. आहारे प्रणने सद्यो बलकृत देह धारकी आयुष तेज समुत्साह त्यो जो ओजो अग्नि विवर्तना. पत्ते सती गतार्दस किमौषधम निश्चेवणम. पत्ते सती गतार्दस किमौषधम निश्चेवणम. Shishika Sutra says the person who follows Patya, there is no need of medicine, and the one who don't follow Patya, there is no use of giving medicine. Acharya said की जे कोणी पथ्य फॉलो नाही करत तर त्याला त्यासाठी आहार हे कधी औषधाचं काम करणारच नाही. आणि तो कितीही चांगला आहार जरी घेत असेल आणि पथ्याचा फॉलो नाही करत असेल तर कुठलं औषध सुद्धा काम करणार नाही. न च आहार समं किंचित वैषजम उपलभ्यते शक्यते अपि अन्नमात्रेण नर कर्तम निरामया. काश्यप साहित्यामध्ये म्हणलेलं आहे आचार्य काश्यप स्टेट्स नो औषधी ॲज इक्विव्हॅलंट टू आहार. द राईट अमाऊंट ऑफ आहार इज एबल टू ट्रीट द डिसीज. काश्यप साहित्यामध्ये आचार्याने म्हणलेलं आहे की जर औषधी जर तुम्ही आहार चांगल्या प्रमाणात घेत असाल, योग्य प्रमाणात घेत असाल तर ते औषधासारखं काम करतं आणि ते व्याधींचं निराकरण सुद्धा करू शकतं. पण जर तुम्ही आहार योग्य पद्धतीने घेत नसाल तर ते कुठल्या औषधीचं काम करणार नाही. आहारालाच त्यांनी औषध म्हणलेलं आहे. So we come to the final thing, that is discussion. The Acharya Kashyap states that ahara is a mahabhaishya. The goal of Ayurveda is to cure the sick and maintain the health of a healthy person. Ahara accomplishes her objective. Agni runs on ahara as a fuel. आचार्य कश्यपांनी आहारालाच महाभैषज म्हणलेलं आहे. आणि आयुर्वेदाचा मुख्य उद्देश, मुख्य ध्येय काय आहे तर रोग्याचं रोग निवारण करणं आणि आरोग्य जो निरोगी माणूस आहे त्याचं आरोग्य टिकवून ठेवणं आणि आहार त्याचं ध्येय हे पूर्ण करतं. If dietary guidelines are adhered to constantly, life expectancy can be increased without disrupting the body's doshas and dhatus equilibrium. जर आपण आहाराचे जे काही गाईडलाईन्स नियम आहे जर आपण त्यासोबत कंटिन्युअसली राहू, त्याच योग्य प्रमाणात जर आपण फॉलो करू तर आपले आयुष्य सुद्धा चांगलं नियंत्रणात राहील. आपलं आयुर्वृद्धी होईल आणि शरीरातले सगळे दोष सुद्धा समस्थितीत राहतील, धातू सुद्धा समस्थितीत राहतील. The human body can be protected against some types of disease by following ahara vidhi visheshayatan guidelines for a healthy and balanced diet, especially non-infectious diseases such diabetes, obesity, heart disease, certain kinds of cancer, bone disorders. जर योग्य प्रमाणात तुम्ही आहार घेता, योग्य आहार घेता आणि आहार विधी विशेषायतनचे जे काही नियम आहेत ते जर तुम्ही योग्य पद्धतीने पाळताय तर तुमच्यासारखे निरोगी व्यक्ती कोणीच नाही. आणि त्याच्यामुळे तुम्ही काही जे असंसर्गजन्य रोग आहे जसे की कॅन्सर असेल किंवा मधुमेह असेल, स्थौल्य असेल, अशा व्याधींना सुद्धा तुम्ही सामना करू शकता. म्हणूनच आहार हे औषधाचं सुद्धा काम करतं. अँड फॉर अ गुड अँड हॅपी एक्झिस्टन्स all 8 types of special direction food are essential. People and doctors who understand the specifics of nutrition are advantageous for long and healthy lives. The concept of Nitya Sevaniya Dravyas, which is discussed by both Acharya Charak and Bhagbhat, clarifies the importance of food in contemporary living. Ahar provides assistance in appropriate bodily growth when consumed in the appropriate manner and dosage. जर योग्य प्रमाणात आहार घेता आणि योग्य मात्रेत तुम्ही घेता तर ते औषधासारखं सुद्धा काम करतं. अ हेल्दी लाईफ इज कोरिलेटेड विथ द एटिंग वेल. एखादा निरोगी जीवन कशाला म्हणणार जे तुम्ही योग्य अन्न खाता आणि योग्य प्रमाणात खाता. आहार इज responsible to improve, prevent and promotion of health as well as it is an etiological factor for many diseases. आहार जसं तुमचं आरोग्य बाधित ठेवतं किंवा रोगांचं नियंत्रण करतं तसंच ते विविध व्याधींच्या हेतूचं काम सुद्धा करू शकतं जर तुम्ही योग्य प्रमाणात आहार घेत नसाल किंवा अयोग्य आहार घेत असाल. A person can only get stronger and look better if they maintain a healthy diet and exercise schedule. एखादा माणूस बलवान आणि स्ट्रॉंग किंवा तो उत्तम दिसू शकतो जेव्हा तो आपलं एक उत्तम असं भोजन करत असेल, उत्तम असं आपलं आहार व्यवस्थित ठेवत असेल आणि दररोज व्यायाम, नियमित एक्सरसाइज करत असेल. So the conclusion काय आहे की आहार or a diet is an essential aspect of our lives that plays a significant role in maintaining health and avoiding illness. All living things can maintain an active and healthy body and mind if they like eating and adhere to the dietary guidelines outlined in Ayurveda. तर सगळे आयुर्वेदामधले जे काही आहार घेण्याचे जे काही पद्धती आहेत, नियम आहेत, जर सगळे कोणी पालन करत असतील तर ते सुद्धा ऍक्टिव्ह आणि निरोगी राहू शकतात. Their lives become prosperous as a result. आहार टेकन विथ अप्रोप्रिएट गाईडलाईन्स अकॉर्डिंग टू आयुर्वेदा इट ऍक्ट्स ॲज औषधी. जर आपण आयुर्वेदाच्या नियमांनुसार आपण जर दररोजचं भोजन घेत असू, आहार घेत असू, तर ते औषधीसारखं काम नक्कीच करेल. मी रेफरन्सेस घेतलेले आहेत, त्याचं मेन्शन मी पीपीटी मध्ये केलेलंच आहे. काही काश्यप संहितामधून घेतलेले आहे, चौकंबा चरक संहितामधून घेतलेले आहेत. थँक्यू.
Thank you, Dr. Ankita Lakshman, for the well-explained paper and poster presentation. Next, we go to the another paper presentation. I would like to invite Dr. Ujjala Suresh Tarkar for the paper presentation on the topic restoration of health of puerperal woman with special reference to Sutika Parijatya.
Good afternoon, all of you. Myself, Dr. Ujjwala Suresh Tharkar, PG scholar of a Stri Rog and Prasuti Tantra Department of LRP Ayurved College and Hospital, Sangli. I am going to present restoration of a health of a puerperal woman with special reference to Sutika Paricharya, guided by Dr. Hemalata Kongi, HOD and Professor of a Stri Rog and Prasuti Tantra Department, LRP Ayurved College and Hospital, Sangli. Abstract. During pregnancy, the physiological and anatomical changes occurs in a pregnant woman. After delivery, woman's body tries to come in a pre-pregnant state. Puerperium is the period following childbirth during which the body tissue, especially the pelvic organs, revert back approximately to the pre-pregnant state, both anatomically and physiologically. According to Ayurveda, Sutika means a woman who gives birth to a baby along with a placenta. In modern, it's called as puerperal woman. Introduction. Pregnancy and delivery are itself immunocompromised state. To cope up with these incidents, lots of bodily changes occurs during this period. In Ayurveda, the proper management of a Sutika has been described. A woman who gives birth to a baby along with the placenta called as Sutika in Ayurveda and puerperal woman in modern science. The puerperal period starts about an hour after delivery of a placenta and up to the 6 weeks following it. Sutika Paricharya is the Ayurvedic term which means nursing or management of a woman who has delivered a baby. In Ayurveda, Sutika Paricharya has been explained by many acharyas. Acharya Charak has not mentioned any exact time. According to Acharya Sushruta, the puerperal woman should be prescribed Bhadradaru Kvata, which suppress the Vata. If some blood still left inside the uterus, the powdered pipali mool, chitraka, shrunga bera should be given with warm jaggery water that should be continued for 2 to 3 days till lochia rubra properly excreted. Afterwards, rice gruel, that is dalia, prepared with a vidari gandhati group mixed with a grit, should be given for 3 days, that is from 4th day up to the 7th day. Then from the 8th day, cooked shali rice with mounseras should be given in the form of yavaku to increase the strength and the digestive power. In Sutika Kal, the Koshna Jal should be given to the woman. The other acharyas mentioned somehow similar management with the different Ayurvedic drugs and some additional management. Aim to understand the importance of a Sutika Paricharya in purpural woman for restoration of her health. Objectives: to establish the correlation between the purpural woman and Sutika, to know the management of purpurium according to Ayurveda, to know the mode of action of a different Ayurvedic drug in the management of purpurium. Material and method: all relevant data regarding purpurium, Sutika, Sutika Kal, Sutika Paricharya collected from classic, recent articles, journals, textbook, etc. Discussion: the woman becomes weak or emaciated due to development of a fetus and also unsteadiness of all the dhatus. The Ayurvedic system of a medicine describes Sutika Paricharya, a complete health regimen for purpural woman. This Paricharya consists of following principles. First, the restoration of the health of a purpural woman, and second, prevent infection. The purpural period in which the Vata is vitiated, so administration of Vatahara drugs are useful. The Ayurvedic management mentioned by the Acharyas has Vatahara, Garbhashaya Shodhana, Agni Deepana property. Due to Vatahara property, it is used to decrease the pain in Sutika Kal and excretion of a lochia. Due to Garbhashaya Shodhana property, it helps to remove all the collection impurities from the uterus and maintain the health and function of uterus. It has Agni Deepana property, so it used for Dhatva Agni Deepan, which helps in a restoration of the health of a purpural woman. Conclusion: as a purpural period is a critical time for a woman, it needs proper management and a care with a specific diet and aushadhi. Sutika Paricharya has a property of a maintenance of a health of a woman. Thank you.
Thank you, doctor. Thank you for the presentation. Next, I would like to invite Dr. Chinmay Bosale for the paper presentation. Dr. Chinmay Bosale, are you there? 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 Okay, next we go to the next presentation. I would like to invite Dr. Aishwarya Balpemore.
Hello.
Hello. Dr. Chinmay, are you there?
Yes, sir. Hello.
Good evening, doctor.
Good evening, sir. I'm having some issue with network, sir.
Okay, doctor. We will share the screen for you, doctor.
Hello. Hello.
Hello. Doctor, please start the session, doctor.
Good evening, sir. Hello.
Good evening, doctor. Please start the session. Dr. Chinmay, please
Hello.
unmute, doctor. You're audible. Please start the session, doctor.
Good evening, everyone. I am Dr. Chinmay Bhosle. I'm doing the MS from Yashwant Ayurvedic College from Kodoli. Today I am going to present deep vein thrombosis, DVT. The thrombus formation in deep vein is known as DVT, that is deep vein thrombosis. It mostly occurs in calf veins, commonly in left more than right. Thrombus can be break and form pulmonary embolism. That is the most dangerous complication of DVT. The common causes for DVT is prolonged starting, obesity, smoking, pregnancy. Varicose vein is also cause of DVT. There's a workers triad that define the venous status, hypercoagulability, and endothelial injuries. His pathophysiology of DVT is endothelial cell injury that causes the platelet adhesion and aggressions, and due to that, the platelet plug formation and thrombus form in large veins. Clinical features for DVT is pain, redness, swelling, cord-like veins, and we get common symptoms that is swelling and patient complain the pain while walking or doing activities. Common side of thrombosis is calf vein, the femoral vein, iliofemoral vein, the, the vein pelvic thrombosis, signs, common signs, signs that also known as common complications of DVT is pulmonary embolism, diseases of heart, CVA. The investigations we rule out for DVT is CBC, D-dimer, Doppler USG, phlebography, plethysmography. There are two types for treatment for DVT, that non-surgical and surgical. Now, in non-surgical treatment, we use anticoagulants like heparin, warfarin. Warfarin we use in the dose of 50,000 to 1 lakh units IV for 4 hours for 7 days. Thrombolytic therapy, we use streptokinase, urokinase IV dose for 12 hours. We can use compression stocks as a conservative treatment for granulation. In surgical treatment, we can use bypass procedure, valvular repair, wall transplant, venous theratomy. We can prevent pulmonary embolism of one ligation of femoral vein, ligation of iliac vein, pathway block, that is umbilical filters. Thank you.
Thank you, Dr. Chinmay. Thank you for the presentation. We'll go to the another paper presentation. I would like to invite Dr. Aishwarya Balfi more for the paper presentation. Aishwarya Baltimore, are you there?
I, Dr. Aishwarya More, PG student of Ayurvedic department, presenting literature review on Chhardi. Chhardi is defined as impurities coming out through the mouth with forceful impulsion covering the mouth and producing tearing pain in the body, meaning Chhardan, vomiting, retching sickness, Chhardi, vomiting sickness. In Ayurveda, vomiting word is used for two different entities. First, woman. There is a procedure in Panchakarma therapy. It has been considered under Pradhan Karma, basically done in Kapha diseases. Second, Chhardi. Chhardi is a disease which is caused mainly due to Kapha and Vata dosha and also caused due to the so many different types of Vitiation type of doshas. The symptoms are also markedly different from each other. Synonyms शब्द रत्नावली छर्दनम उत्कासिका सेकंड राजनिघंटू उद्गार छर्दी छर्दिका वांति. Types of Chhardi. There are many types of Chhardi. Doshas type Vataj, Pittach, Kaphas, Sannipatach. Agantosh type Drishtartaj, Dauruddaj, Amach, Krumij. Etiological factors सामान्य निदान क्षीरपावस्था breastfeeding with vitiated breast milk especially with kapha स्तन्यदुष्टि breastfeeding in lying position any infection of GI tract inappropriate burping after feeding top feed intolerance excessive breastfeeding than required forceful feeding worm infestation and dentition अन्नदावस्था अतिद्रव अतिस्निग्ध अति अहृदय अतिलवण अकाल अतिमात्र असात्म्य भोजन श्रम भय शोक उद्वेग अजीर्ण कृमि दोष विशेष निदान. The निदान of various types of Chhardi are being discussed under respective heading as follows. वातज Chhardi अति व्यायाम तीक्ष्ण औषधि शोक भय उपवास अतिकर्षणम. पित्तज Chhardi कटु अम्ल आहार सेवन विदाई आहार अजीर्ण. कफश छर्दी निदान अतिस्निग्ध आहार अतिगुरु आहार सेवन विदाही भोजन आम दिवा स्वाप. सन्निपात छर्दी habitual intake of wholesome and unwholesome ingredient together having sarva rasas amadosha because of seasonal parvajan or etiological factors aggravate all three doshas simultaneously and produces the three doshas Chhardi. Drishtarta Chhardi, Agantush Chhardi. Under Agantush Chhardi, again divided into 5 types. They are Bibistaj, Dauridaj, Asatmyaj, Krimij, Amaj. Lakshanas, clinical features. Lakshanas are useful for the clinical knowledge of disease. The symptoms of Chhardi can be taken into categories like Samanya Lakshan and Vishesh Lakshan. Samanya Lakshan, general clinical features. The general symptoms of Chhardi are as follows. Anna suddenly come into the mouth, feel it, expel forcefully with Anga Bhajada and Mukha Vairasya. Vishesh Lakshan, Vata Chhardi, color Krishna blackish, अच्छा कषाय तनु सफेन विच्छिन्न पीड़ा पार्श्व पीड़ा शिरशूल पेन at umbilical region खास तोद local features मुखशोष आस्यशोष स्वर पीड़ा nature of vomiting सघोष अल्प अल्प वेगवत. पित्त छर्दी आम्ल तिक्त कटु पित्त हरित धूम्र वमित सदाहम उष्ण सश्रुष तृष्णा ड्रायनेस ऑफ माउथ मूर्छना दाह तम भ्रम ज्वर चोष शोष मुखशोष कफच छर्दी शुक्ल लवण मधुर सांद्र घन स्निग्ध शीत श्लेष्म प्रभुतम मुख माधुर्य कफ प्रसेक गौरव तंद्रा अरुचि निद्रा संतोष हरुल्लास रुक कास. सन्निपात छर्दी नील रक्तम लवण आम्ल सांद्र प्रसक्त शूल अरुचि दाह तृष्णा प्रमोह लक्षण of कृमिश छर्दी. कृमिश छर्दी are like of कृमिश हृदरोग. General features शूल उल्लास, शोष कंडू, श्राव नेत्रता, हृदय प्रततम. आगंतुक छर्दी उदर शूल उल्लास बहुलता resembles like कृमिश हृदरोग. छर्दी संप्राप्ति विरुद्ध आहार सेवन that causes त्रिदोष प्रकोप, especially पित्त प्रकोप, उष्ण and तीक्ष्ण गुना. Then कफ वृद्धि, वात प्रकोप, उदान and वान, उदान वायु and व्यान vayu moves upward. Vata, pitta and kapha present in Amashaya and Ura Pradesh moves upward, comes out through mouth and causes chhardi. Treatment. In children, the cause of vomiting are different as per age of children. Treatment should be given as per the causes. Nidan Parivarjan. The main important treatment in the chhardi in children is Nidan Parivarjan. Shodhan Chikitsa. In case Dushtastanya caused for chhardi, so it will used Shodhan Chikitsa. Time interval between two breastfeed are appropriate. Timetable should be maintained. The breastfeeding will be given as per demand, otherwise forceful breastfeeding leads to vomiting. In children, vomiting which caused by ajirna should treated with Dipana Pachan Aushadhi Chikitsa. Shatapushpa Arka is best yoga in vomiting caused by ajirna. Chikitsa Siddhant. All type of chhardi are caused due to irritation of amashaya. Hence, Langana is the first line of treatment in chhardi. Except in Vatas chhardi, Langana is contraindicated. If doshas are mild, Langana is recommended. Similarly, Shodhan is indicated in severely affected doshas. पथ्यहीन चर्दी. भुक्त मात्रस्य शीतांबु सेवन, शाक, पानक, परिशिष्ट चर्दी, प्रिय भोजन, लघु भोजन, सात्म्य, विचित्र फलानी, उपवास, युष, मांसरस. अपत्यहीन चर्दी, असात्म्य, अहृदय, विरुद्ध अन्न, उष्ण स्निग्ध अन्न, द्रव अन्न, नस्य, स्वेदन, स्नेहपान, रक्तमुक्षण, दंत काष्ठता, भीती, उद्वेग. Thank you.
Thank you, Dr. Aishwarya. Thank you for the wonderful presentation. Next, I'd like to invite Dr. Pranita Vijaykumar Galande for the poster presentation.
Hello, yes, sir.
Good evening, doctor.
Yes.
Please share the screen, doctor.
Hello.
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 Hello, you are audible, doctor. Your screen is also visible.
Yes, sir.
Please start the session, doctor.
Yes, sir. My topic is endometriosis. I'm going to present poster presentation on endometriosis. Definition: presence of endometrial tissues, glands or stroma outside the uterine cavity. Endometriosis can occur anywhere in body, including abdominal wall, lung, pleura, brain, and arm. Then what are the common sites? First of all, ovaries, pelvic peritoneum, pouch of Douglas, uterosacral ligaments. Then classic triad of endometriosis. First is dysmenorrhea. Most common is triple dysmenorrhea. That is before, during, and after menses. Infertility, dyspareunia. Risk factors for endometriosis are low parity, delayed childbearing, family history of endometriosis, genital tract obstruction, and molecular defects. Pathology, lesions are powder burn appearance and ovary. Most common is characteristic is chocolate cyst. Then clinical features may mostly it is asymptomatic. Most common symptom is secondary dysmenorrhea, dyspareunia, deep-seated pelvic pain, premenstrual and postmenstrual spotting, infertility. On examination, fixed retroversion of uterus, firm fixed adnexal mass, and tender nodularity of uterine ligaments. Then what are the investigations? Mostly laparoscopy. Gold standard investigation is histopathological examination, then CA-125 and MCP-1. Management, managing pain and managing infertility. Then for pain, to manage the pain, we can give non-steroidal anti-inflammatory drugs, moderate to severe disease. Drug of choice is GnRH agonist. We can start it with progesterone. Then what are the surgeries are done? Adhesiolysis, fulguration of implants, presacral neurectomy, hysterectomy, management for infertility, IVF, superovulation with clomiphene followed by intrauterine insemination. Thank you, sir.
Thank you, Dr. Pranita, for the wonderful presentation. Thank you so much, Doctor. As we come up to the conclusion of the Dharaka National Seminar presentation 2024, I would like to extend my heartfelt gratitude to our panel members who have stood with us throughout, ensuring the success of this event. We witnessed several remarkable presentations today, and I express my sincere thanks to all the presenters for their valuable contributions. A special note of thanks to the principals and professors from various colleges who supported us in making this event a success. I am confident that the knowledge shared today will benefit many and leave a lasting impact. With that, I officially draw the curtain on the Dharaka National Seminar presentation 2024. Thank you everyone for your participation